This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound.
Members, before we commence the sitting, I remind members that as a mark of respect, the Business Committee agreed to defer all non-essential business scheduled for this week. Yesterday's Assembly and executive business, including question time, are being taken today. To enable business to flow more smoothly today, a motion to suspend Standing Order 21 has been scheduled, which, if agreed, will allow question time to commence as soon as all other executive business has been disposed of. There will be no lunchtime suspension, and the Business Committee will meet immediately after the Assembly adjourns. And I would encourage members and ministers to keep a close eye on proceedings to ensure that they are in the chamber when their business is reached. Next item of business on the order paper is a motion regarding committee membership, and as with other similar motions, it will be treated as a business motion and there will be no debate. Clerk, please read the motion.
That Mr Mervyn Storey replace Mr Gordon Dunn as a member of the Committee for the Economy.
I call Keith Buchanan to move the motion.
Moved.
The question is that the motion standing on the order paper be agreed. All those in favour say aye. Contrary, no. I think the ayes have it. The ayes have it. The next item of business on the order paper is a motion to suspend Standing Order 21. It will be treated as a business motion and there will be no debate. Clerk, please read the motion.
That Standing Order 20(1) be suspended for the 13th of April 2021.
Before we proceed to the question, I would remind members that this motion requires cross-community support. I call Keith Buchanan to move the motion.
Moved.
Thank you. Before we proceed to the question, I would remind members that this motion requires cross-community support. The question is that the motion standing on the order paper be agreed. All those in favour say aye. Contrary, no. The ayes have it. As there are ayes from all sides of the chamber and there are no dissenting voices, I am satisfied that cross-community support has been demonstrated. The motion is agreed. I have received notice from the Minister of Health that he wishes to make a statement on trust rebuilding plans. Before I call the Minister, I remind members here in the chamber that in light of social distancing being observed by the parties, the Speaker's rulings that members must be in the chamber to hear a statement if they wish to ask a question has been relaxed. Members participating remotely must make sure their name is on the speaking list if they wish to be called. Members present in the chamber must also do this, but may do so by rising in their place, as well as notifying the business office or Speaker's table directly. I remind members to be concise in asking their questions. I also remind members that in accordance with long-established procedure, points of order are not normally taken during a statement or the question period thereafter. I call the Minister for Health.
Thank you, Mr. Speaker. Thank you for your opportunity to speak here today. But before I move to the substantive content of my statement, I'd like to pay my respects to the late Duke of Edinburgh. Prince Philip was a truly extraordinary individual, a distinguished veteran of the Second World War and someone who dedicated his entire adult life to selfless public service, and someone who was at the helm of the royal family for longer than most of us have even been alive. He was an anchor of steadfastness, and it was clear that his total and unswerving dedication and devotion to his country, his charitable interests, including being patron of a number of health organisations, and most importantly to his wife, Her Majesty the Queen, has made an immense contribution and one which can never be overstated. Mr. Speaker, my motivation of today's statement is twofold. Firstly, I would like to update the House on our immediate plans for rebuilding our health and social care services. Indeed, I am today publishing the Trust Rebuild plans for the month of April, May and June. Secondly, and perhaps more importantly, I would like to provide an update on some of my longer-term rebuilding initiatives. I will focus on our cancer services, our long and growing waiting lists, and on the significant constraints I am facing in tackling these. Our health service prides itself on being available to all, free at the point of access. I will today contend that we are still in grave danger of undermining this essential feature of our health service. With ever-growing waiting lists, I would question whether all of our citizens have adequate access to the health service that they need. The people of Northern Ireland deserve better than having to wait months and, in many cases, years for access to elective health care. Many suffer pain and discomfort while they wait, and we simply cannot let this situation continue to deteriorate. I am absolutely determined to put this right, but as I will argue today, I cannot do this alone. I need the support of this House and my executive colleagues if we are to address our absolutely dire waiting lists. Before I delve further into this issue and cover the Trust Rebuild plans, I would like to set the scene by briefly outlining the recent history of where we find ourselves today. The pandemic has highlighted serious, long-established fragilities in our health and social care system, especially in terms of staffing capacity. Our health and care system was already under immense and growing pressure long before the pandemic. 10 years of financial stringency and short-termism had undoubtedly taken its toll. During the last decade, our health system has been repeatedly documented as being out of date and failing. In his 2015 report, The Right Time, the Right Place, Sir Liam Donaldson referred to Northern Ireland as having an ossified model of care, with specialist staffing resources too thinly spread. Similarly, the 2016 Bangor report which was endorsed by the then Northern Ireland Executive and the other parties in this House, referred to the model of care as outdated and not the one that Northern Ireland needs. It also stated that the current configuration of acute services is simply not sustainable in the short to medium term. The following year, an expert panel assessed our adult social care system in the report Power to People and concluded it was collapsing in slow motion. The decade of chronic underfunding has had consequences, not least in terms of a failure to build greater capacity and resilience. We have some of the best staff and the most innovative treatments in the world. Northern Ireland should simply not have the waiting times it has. They have been intolerable for some time and they have only grown worse. The time for words of concern has passed. I firmly believe we require a period of firm action now. The hundreds of thousands of people who are on a waiting list deserve no less. The pre-existing fragilities in our system also undoubtedly hampered our response to the pandemic. They also underline the particular need for caution in Northern Ireland as we re-emerge from lockdown. It is in this context that I am today publishing Trust Rebuild plans for the period of April to June 21. The publication of these plans come as we emerge from the severe third COVID wave, which has further depleted the resilience of our health and social care system. Over this winter, our health and social care services have been under pressure like never before, and I am pleased that we are now coming out of the latest COVID-19 wave. And whilst there is no time for complacency, the highly successful rollout of the vaccine is giving real hope. I am aware that our hard-pressed health and social care staff, especially those that have worked in the most challenging roles over the last 13 months, are in need of rest, and this is reflected in the Trust Rebuild plans. However, I also know that they wish for nothing more than to return to their normal duties, delivering the care they are expertly trained to do. And I am hopeful that the publication of these plans signal a gradual return to such normal duties for our staff. The Trust Rebuild plans are in fact based on 5 principles, which include the first, that we de-escalate the ICU as a region. Second, that staff are afforded an opportunity to take entitled annual leave. Third, that elective care is prioritised regionally to ensure that those most in clinical need, regardless of place of residence, get access first. Fourth, that all trusts seek to develop green pathways with the aim to maximise theatre throughput. And fifth, that the Belfast City Hospital Nightingale is prioritised for ICU de-escalation to increase regional complex surgery capacity as quickly as possible. In terms of the fifth principle, Mr. Speaker, I confirm that the Belfast City Hospital Nightingale is now closed, with the last remaining ICU patients vacating the site on Friday the 9th of April. I am also pleased that the Trust Rebuild plans reflect our many regional initiatives, not least my action to ensure that all elective surgery is prioritised in line with greatest clinical need and not dependent on a patient's postcode. Also published today with the Trust Rebuild plans is a data annex, which sets out the Trust activity projections for the 3-month period, April to June. The activity projections for May and June are indicative at this stage and will be reviewed in early May. This reflects the ongoing high degree of uncertainty we continue to face, but it is also because I want to make sure that if it becomes clear over the coming weeks that trusts can do more, then I expect them to, even under the context of many competing challenges and uncertainties. I still want to see as much activity delivered and quickly as it can. Mr. Speaker, with the immediate Trust Rebuild plans published, I would like to spend some time on our growing waiting lists and waiting times. There is no doubt that the pandemic has had a devastating impact on our hospital services, particularly elective care. The downturn in elective surgery, while deeply regrettable, reflects the unprecedented pressures of the COVID-19 pandemic. It isn't right that any patient should wait longer than is clinically appropriate for surgery, and I fully understand the distress and anxiety that long waiting times cause, particularly when patients are suffering pain and discomfort. Staff were redeployed to help manage the high number of patients being admitted to our hospitals, and to allow the system to increase critical care capacity. For the past year, rightly and unavoidably, our priority has been urgent and emergency care and to provide ICU care to those who needed it. It was not lockdown that added to waiting lists and led to much-needed operations being postponed. It was the virus. Our system, like systems all over the world, simply could not maintain a normal service given the surge in patients requiring life-saving and immediate interventions. Staff had to be redeployed. Agonising choices had to be made. This was not about prioritising one condition over another. It was about providing care to the sickest patients quickest. It was about maintaining ICU care for everyone who required it, COVID and non-COVID patients alike. Despite these challenges, a number of actions have been taken to maintain elective services as much as possible. We have also pushed ahead with important reforms to our urgent and emergency care services, and these initiatives demonstrate that despite the pandemic, we have continued to deliver much-needed reform of services. I will now turn to some of these initiatives in more detail. In regards to actions to maintain elective services and reform services, we have created Northern Ireland's first regional day procedure centre at Lagan Valley Hospital in the South Eastern Trust. This day procedure centre has been providing support for the region, particularly for urgent cancer diagnostic work. Similarly, surgeons from across Northern Ireland have been travelling to the South West Acute Hospital in Enniskillen to provide surgery that could not be provided at other sites due to the rising number of COVID-positive inpatients. I have also announced a new regional approach to orthopaedic surgery, and this involves developing a network regional system of dedicated hubs. As I've already mentioned, I have also established a new regional approach to the prioritisation of surgery. This will ensure that any available theatre capacity across Northern Ireland is allocated to those patients most in need, both during surge and in the future. This includes fully maximising all available in-house health and social care and independent sector capacity. Whilst this may mean that patients will need to travel further for their surgery, I would rather see the highest priority treatments delivered across Northern Ireland than lower priority treatment delivered locally. The Health and Social Care Board is also continuing to work closely with independent sector providers, increasing the capacity available to provide elective care in the coming months. Access to the independent sector will also be managed on a regional basis. I have also pushed ahead with the much-needed reform of our urgent and emergency care services, and fantastic progress has been made. This not only puts us in a stronger position for the future, but has also allowed us to more effectively manage the impact of COVID-19. Indeed, I intend to publish for consultation in the near future further proposed steps to reform this important service. Mr Speaker, despite all of these initiatives and the incredible dedication of all our health and social care staff, we are facing a burning platform. The pandemic has had a significant impact on our already appalling waiting lists. Arguably the greatest strategic challenge facing my department, and indeed the Executive as a whole, is the urgent need to address these waiting lists. Prior to COVID-19, the trend in demand for hospital-based elective care services had been increasing, largely due to the fact that we have a growing, ageing population with a greater prevalence of chronic health problems. This increase in demand was not matched by the corresponding increase in health service budgets necessary to increase our capacity. Patient demand for elective care services continues to exceed capacity across a range of specialities, and as a result, even before the pandemic, the number of people waiting longer than the target waiting times was increasing. Our inadequate capacity includes well-documented and significant staffing pressures in many parts of our system. Underinvestment in staffing in the past decade was the exact opposite of what was required. On top of this, our outdated configuration of services means staffing resources and expertise are too often stretched too thinly across the system. The latest available figures on our waiting list suggest that at the end of December 2020, there were more than 320,000 patients waiting for their first consultant-led outpatient appointment. More than 105,000 patients were waiting for inpatient or day case treatment. Around 145,000 were waiting for a diagnostic test. To address this issue, I can today announce that I intend to very shortly publish an elective care framework. The purpose of this framework is to set out both the immediate and long-term actions and funding requirements needed to tackle our waiting lists. Mr. Speaker, bringing our waiting lists to an acceptable level is a long-term effort, requiring a recurrent funding commitment. I appreciate that many members have specific concerns around our cancer services. My department has much activity underway to stabilise and improve diagnosis, treatment and life changes to cancer patients here. Staff and Health and Social Care Trusts have worked hard to ensure that the systemic anti-cancer therapies and radiotherapy have been protected throughout the surge, and these treatments have been offered as an alternative to surgery whenever possible. In June last year, I established a cancer service rebuilding cell to oversee the resumption of cancer screening, diagnosis and treatment in clinically safe environments as quickly as possible, and to protect these services as much as possible throughout the pandemic. Taking into account existing capacity constraints and the ongoing threat of COVID-19, I published a policy statement on the 7th of October 2020 setting out my department's approach to rebuilding and stabilisation of cancer services, and that included a stabilisation plan for oncology and haematology and cancer service rebuild plans, and details are available on my department's website. As we continue to stabilise and rebuild services in these challenging circumstances, it is important to note that all patients are treated accordingly to clinical priority, as determined by specialist clinicians. One of my primary aims is to ensure the continued delivery of high-quality cancer services, provided, of course, that it is safe to do so. Presently, trusts are keeping the position under daily review under reinstating red flag surgery and rescheduling patients as quickly as possible. Fortunately, the vast majority of patients that experienced a delay from January to March this year have since already had their treatment completed or have a confirmed plan in place. The COVID-19 pandemic has undoubtedly had a devastating impact on cancer services, and I understand the worry and concern that long waiting times can cause for patients and families. I am committed to dealing with this problem, and therefore I am currently finalising a cancer recovery plan, Building Back, Rebuilding Better. This plan seeks to make recommendations to redress the disruption to cancer services caused by the pandemic. The Cancer Recovery Plan is also fully aligned with the short-term recommendations in the cancer strategy and will focus on a 3-year period up until March 2024. The recommendations cover 11 key areas from screening through to palliative care and have been co-produced with the Health and Social Care Board and colleagues from across the Health and Social Care Trusts. There are substantial costs associated with the delivery of both the recovery plan and the strategy. In addition, cancer charities are struggling to continue to deliver current services and develop new services to those people suffering from cancer while managing the impact of falling income streams. To support cancer services, I have used both transformation and COVID-19 funding to set up 2 grant schemes. The first used transformation funding of £600,000, which covered the period from December 2020 to the 31st of March 2021, and enabled charities to deliver a range of key services to support people living with cancer during the pandemic. I hope to be able to announce further details of the second scheme, which will be aligned with the 3-year time frame of the Cancer Recovery Plan later this week. I am pleased to be able to confirm that it will also be accompanied by an important mental health support scheme, one that will be appropriately resourced to produce greater levels of mental health supports and interventions. The final details of both these funds are currently being concluded, and I do hope once that they are announced in the coming days that they will demonstrate the importance on which I am placing recovering and strengthening those crucial services and supporting those organisations that will be central to that. It is widely recognised that addressing the waiting list backlog and reforming services to ensure future sustainability is a complex and long-term issue, one that requires recurrent funding commitments. Let me make it very clear, Mr. Speaker. that one-off COVID funds have been essential for health and social care over the past 12 months. As I have repeatedly stressed, one-off non-recurring funds cannot provide the long-term fix that our health service requires. Nevertheless, they have been vital during the emergency we have faced during this pandemic. I will continue to utilise such funding to the best of my ability for as long as it is available. In recent weeks, I have been able to allocate one-off funds to specific priority areas. The debt the health service and wider society owes to unpaid carers, for instance, cannot be overstated. Without care provided by family members and friends, many vulnerable people would have been plunged into full-scale crisis over the past 12 months. I have allocated £4 million to a new carer support fund, which will provide support for charities working for and with carers. The support fund will provide practical support and acknowledgement to what is such an important sector. All of these allocations, such as the additional grant support to the air ambulance and a range of our community and voluntary sector organisations, as well as the major funds I hope to be able to announce this week, have been made possible as a result of the one-off COVID funds made available to Northern Ireland during 2020-21. I would, of course, love to be able to allocate further funding on a recurrent basis to all these areas, but as ever, available recurrent funding is not keeping up with levels of demand and need. As members will be aware, the executive budget has now been announced by the Finance Minister, and I recognise that the 2021-22 budget allocation was disappointing for all departments, and that the scale of pressure significantly exceeded the funding available. From my perspective, the budget is extremely disappointing. Tragically, as it stands, I cannot make any substantial inroads into improving the waiting list position I have just outlined. That said, I welcome the £52 million for Agenda for Change pay, which will enable pay parity with England to continue in 21-22, and likewise the announcement that £20 million for safe staffing will now be funded from the Barnett consequentials as a positive move. It has to be recognised, however, that while the additional resource allocations included in the budget are to be welcomed, the non-recurrent nature of much of this funding means I will still be faced with some difficult decisions. The present funding model which we operate within is not fit for purpose. What is really needed is a multi-year budget, and unfortunately the Executive hasn't received this from Westminster. One-off COVID funding cannot be effectively deployed in rebuilding services, as this requires us to make multi-year commitments to training places and to appoint people to permanent posts in order to attract and retain staff. We require major investments on a sustained basis to rebuild our services, in particular increasing the capacity of our elective care system, whether in-house or in the independent sector, requires a significant recurrent funding commitment. Only with such a commitment can we begin to invest in the staff and infrastructure required to make progress. At a minimum, what is needed is a recurrent source of earmarked funding agreed in advance to close the capacity gap and address the patient backlog. An incremental year-on-year increasing allocation will be required, and it could take 5 to 10 years to return waiting times to an acceptable level. Longer-term surety of funding at a significant scale will enable innovations both in-house and with independent sector providers. Mr Speaker, can I again thank you for the opportunity to speak here today. At the heart of my address is a genuine concern for the people of Northern Ireland, for the hundreds of thousands on our elective care waiting lists, and for the many more who will need access to these services in the future. Failure to tackle the elective care waiting list will not just impact on those currently waiting, it will impact on all those who need access in the future. This issue affects us all. It would also be morally reprehensible, as we must not lose sight of the fact that for the last 5 to 6 years, despite all the advances in medication and technologies, that growing numbers of people have been coming to harm because they haven't been receiving the treatment they deserve. Who does not have a loved one, a friend or a relative who at some point, either now or in the future, will need to access an elective procedure? We as a House owe it to all our citizens to now tackle the elective waiting lists. To address this burning issue, I will in the near future be publishing for consultation a cancer recovery plan, an elective care framework and the urgent emergency care review. Our great staff want us to be ambitious about the future of health and social care. They want us to build back better, to learn the lessons of the pandemic in terms of capacity, resilience and investment. I share that ambition, 100%. I believe the people of Northern Ireland do too. However, without a significant and recurrent funding commitment from the Executive, I fear that we will be severely restricted on our ability to deliver. We will be fighting the scourge of waiting lists with at least one hand tied behind our backs. I would ask members and my Executive colleagues to reflect on what I have said today. I look forward to having further constructive discussions about how we collectively address this most serious issue. And let me conclude by making an appeal for unity on waiting times across this House. We must start putting this right. It is a long-term task and it needs long-term, recurrent funding. It can't be done on the basis of here today, gone next year money. To properly put waiting lists right, we will clearly need more staff in our health service. But how can you recruit additional people to the workforce if there's no certainty you'll have the money to keep paying them next year? How do you sign up more young people for the required years of training on the basis of single-year funding? I recognise there are many pressing rival demands on the public purse in Northern Ireland. Huge issues face every department. I fully accept that the Executive has limited room for manoeuvre in budget terms. Decisions are taken in London and we have to play the cards we are dealt. However, I cannot think of a more pressing issue facing us than waiting times. It cries out for action. It is a daily rebuke to the standing of this House and to the reputation of politics. It leaves thousands and thousands of our people in unavoidable pain, our fellow citizens or neighbours. We owe it to them to do much, much better. Mr Speaker, I commend this statement to the Assembly.
Thank you, Minister. And can we please bring Colm Gildernew on screen? Give him a few seconds. Well, we try and return to Colm Gildernew and now call Pam Cameron.
Thank you, Mr Speaker, and thank the Health Minister for this statement and welcome any ramping up of services and indeed of reform of our health service. Minister, there are many people who are waiting not just for cancer operations or diagnostic tests to detect cancer and other potentially fatal diseases, but there are also many people waiting for more routine elective care surgery, those who are literally living in agony, and some of them have been waiting for an entire year for that vital healthcare they so badly require. In the plan for an elective care framework, how does the Minister envisage this will be given significant enough recurrent funding to effectively reduce waiting lists and meet targets to bring them up to more acceptable levels?
I thank the Deputy Chair for her question, and can I apologise for not being able to brief her and the Chair prior to making this statement due to an executive meeting this morning, as well as would normally have been my practice. In regards to the specifics of elective care, I think one of the things that we'd done during the pandemic was actually the establishment of the elective care centre in the Lagan Valley Hospital. That is now proven to be a great asset to our health service across Northern Ireland. And it is about establishing that as a long-term part of our solution to how we reduce the number of people waiting on elective care. But as I said in my statement, it must be done on a regional approach. We must look at getting patients treated quicker and faster rather than closer to their homes, which would be the ideal position. But as the size of Northern Ireland that we have, the footprint we have within our health service, the staffing specialities and pressures that we currently have, the regional approach that we're now seeing in Lagan Valley and other areas that we have made those changes is paying dividends. And it's about investing in the staff, it's about investing in the processes that allow that regional approach actually to work. One of the benefits that we've seen over the past year is the breaking down of silos across our trusts. Silos that were never intentional, silos that were never created by anybody in particular, but grew up over time. We have now seen our health service colleagues working across sectors, working across trusts, working across primary care, community pharmacy, secondary care, and it's about building on that for the future so that we get the people that we need to be seen as quickly and efficiently as possible.
Can we please bring Colm Gildernew on screen now, if we can? Can I call Colm Gildernew, the chairperson of the Health Committee?
Cormagat, Ceann Corlia. Cormagat, August Cormagat, Gucci and Ira. Thank you to the Minister. Minister, thank you for making your statement here today. And I note and I share your concern around the waiting lists. And I think those are a concern for us all, as you rightly point out, in particular those 145,000 approximately patients waiting for a diagnostic test, which is putting further pressure on those individuals, but also potentially on the health service in terms of increased treatment needed. But Minister, we've previously seen very good examples of considerable partnership working on rebuilding and reconfiguring services, including cancer services, breast cancer and stroke in particular. I note that several plans are to be published on emergency departments, on elective care, and on a cancer recovery plan. I am somewhat concerned to see in your reference to the cancer strategy that it has been co-produced with the Health and Social Care Board and also with the Health and Social Care Trusts, and I would suggest that's a fairly minimal approach and basically doesn't include some of the very important other sectors. So what commitment, Minister, can you give that these plans were developed with staff and patients in a genuine spirit of co-production and partnership working as promised in Bengoa and delivering together?
I think that the Chair for a statement, that, and as he is aware, there's many of these plans that have been announced today have been a long time in the cooking and in the development from Bengoa, from transforming your care from power to the people, and they've all been done with that co-production, co-development phase throughout the entirety of this. Especially in regards to our long-term cancer strategy, which has been co-produced, has been co-chaired, and will remain using those people who need these services most right at the heart of the centre of what we do. That co-production has also been done in the review of our elective care model as well, because that has been a long time in the development as well. So it is about keeping patients at the centre of what we do, but it's also about making sure that we get the ultimate utilisation of our footprint and our staff across the entirety of our service. This isn't about redesigning or closing hospitals or paying staff off. This is about actually indicating that we need every square foot of capacity that we have. We need more, and we need more staff to actually do that. I regularly meet, as the Chair well knows, with our trade union side, with the chairs of all my arm's length bodies as well, to make sure that they are fully embedded of everything and have sight of everything that we're doing as well, and also the accountability that we hold to the committee as well in producing these and coming forward with these plans and programmes for your scrutiny and your assessment.
Can we please bring Cara Hunter on screen?
Thank you, Mr. Speaker, and I'd like to thank the Minister for his statement this morning. Minister, I know that you share my commitment to improved mental health services, and I welcome the statement this morning that you had mentioned regarding the cancer recovery plan and it being accompanied by mental health support for patients on waiting lists. My question today refers to mental health waiting lists specifically. More broadly, I believe that as we emerge from the pandemic, now more than ever, mental health support will be necessary. Can I ask the Minister for an update on crisis intervention services to support those on mental health waiting lists should they need it, and if he sees improved support for these critical services as part of a longer term rebuilding of services as a whole? Thank you.
And I think the member's fully aware of my commitment to improving our mental health services across the entirety of Northern Ireland, and that's why even during the height of the first wave of the pandemic that I went ahead and published the mental health strategy and the consultation plan in regards to that. I hope to make further announcements in regard to the coming days to additional monies that will be allocated to mental health supports for people who need it across our society, especially as we come out of this pandemic as well, that will be accessible to a number of organisations and individuals that hadn't been previously there before. The detail of that is still being worked through, and I look forward to publishing that and giving the member and the committee a fuller briefing later this month.
Thank you. And I call Alan Chambers.
Speaker, I certainly welcome this comprehensive statement from the Minister this morning. And during the pandemic, Mr. Speaker, a phrase that kept coming up was, "We're in this together." And if ever there was a challenge facing this House where we need to be in it together, it is the challenges that the Minister has highlighted this morning. And I think party political considerations will need to be set aside going forward. Minister, tackling our waiting list position should be a key objective for the entire Executive. To put our system on a long-term sustainable footing, it does desperately need financial certainty of more than a 12-month budget. Nevertheless, in the meantime, can the Minister confirm that his department and the Health and Social Care Board are utilising the interim COVID funds to increase capacity as much as possible, including in the independent sector, both inside and outside of Northern Ireland? Thank you.
I thank the member for his question, and I think all in this House, at least some time, have said about the long-term need for the financing of our health and social care system, but also the need of a budget that is simply year on year. No matter what minister, what department has been to this House, has indicated the challenges that brings, no more so than in health, because it does not allow us to give that firm long-term commitment that we need to invest both in our staff but also in our facilities as well. And in regards to the utilisation of the independent sector, it's something that we have engaged with. It's a necessary part of our recovery plan to try to drive down some of the waiting lists that we have. Our independent sector and healthcare providers during 21-22 have completed more than 7,000 procedures. Endoscopic diagnostic tests have been carried out by them, all paid by the health and social care system. And in addition, as a result of health and social care having access to theatre capacity in the 3 local independent sector hospitals, approximately 4,750 cancer or time-critical patients were treated by HSC consultants, again paid for by the health and social care system. So it is about utilising, as I've said, every square foot of our health service and the independent sector across Northern Ireland as we tackle what will be a long-term commitment, and it's a long-term commitment that I think the member indicates has to be party political free. I think Bengoa set the tone for that. I think New Decade, New Approach and its commitments to reducing our waiting lists set the tone for that. But now we as a House and I think we as a society need to follow through on that commitment, that health needs to be a priority for all, irrespective of faith, favour or party political alignment.
I call Paula Bradshaw.
Statement this morning. I share the Chair of the Health Committee's concerns that you're talking about pushing forward with reform and then talking about coming back and consulting with the wider public on that, but I'll not labour that point. In the statement you talk about 145,000 patients are waiting for a diagnostic test. Obviously a key area for that is in terms of cancer. I chair the all-party group on cancer, but I wasn't aware that the Department of Health was at an advanced stage to really take forward the recommendations from the various work streams. So could you provide us with an update on how investment is needed for a better diagnostic testing, and whether consideration is given for some of those resources to be put down into primary care and possibly even into the community and voluntary sector? Thank you.
I thank the member for her statement in regards to how we tackle this, and I thank her for her support and the work she does as chair of the all-party group on cancer, because I think that is, it's one of those diseases that has touched every family across Northern Ireland, especially those in this House. But it's how we utilise, as I said, we'll be making further announcements in regards to additional funding that will be supplied for that 3-year cancer recovery fund, which has been there. That is currently being produced. It will be worked with across with a number of community and voluntary sectors who specialise in this area, so we can make sure that that funding is utilised for the time commitment that is available for us to use, but it also that it supports everyone across the voluntary and community sector, but also across the health service, and it's not simply there to plug a gap, that it's there to do additional work over that 3-year period. And the member will be aware, as chair of the All-Party Group on Cancer, of the co-production and co-design of our cancer strategy over many years. It was actually paused this time last year because of the pandemic. That ingrained work, the co-production, the co-chairing actually of a service user of that piece of work, I think was crucial to get us to where we are at this stage, so that we can really take this opportunity, this investment, to try to redress some of the inequalities that we've seen on a postcode basis across Northern Ireland, especially in regards to cancer diagnostics, but also in cancer services. We need to be honest with the people of Northern Ireland. This won't be about having everything on your doorstep. That's the easy cry, that's the easy political campaign. This is about rebuilding our health service so we can get people seen as quickly and as efficiently and as safely as possible, so they can get the service, the diagnosis and the diagnostic test that they need, so they can get onto a treatment path if it's necessary as quickly as possible, not as close as possible.
I call Jonathan Buckley.
Mr. Speaker, and indeed this is a very bleak statement from the Minister today to the House, and it's clear that the current situation cannot continue. It is unsustainable. The COVID pandemic for many of our constituents sadly has become a healthcare pandemic, which actually rocks the very principles of the NHS, which you have outlined, that being available to all and free at the point of access. So I share the Minister's concern wholeheartedly, and I want to see the same vigour from the Executive in engaging on this issue as we have in the fight against COVID-19. So can the Minister indicate the recurrent funding shortfall that would be required year on year to implement the strategy that he has outlined within the statement? And on the longer term issue, because we know that waiting lists will not be dealt with immediately, it requires a long-term strategic plan. But capacity is an issue, capacity with our staffing and indeed space. So that engagement with the independent sector is going to be crucial in the immediate term. Can the Minister perhaps outline that engagement that will happen immediately with that independent sector? Thank you, Mr. Speaker.
And I thank the member for a statement. And again, I think he highlights the challenges there. The National Health Service is precious to me. It's precious to me not just as Health Minister, but it's precious to me because of the support that my family has received from it, like many families in this House, like many families across Northern Ireland. And it's that core strength of our National Health Service being free at the point of need, free at the point of care, and free at the point of delivery, no matter what the ailment or the stress that is there. And it's how we build up that capacity, not just in staffing, but also in a recurrent footprint as well that is invested in. But again, the member highlights, and I thank him for his support in regards to the challenges that not having a recurrent budget in health actually presents, because it does not allow us to do that long-term challenge, that long-term change that we need to see, that we need to do in the health service across the entirety of our place, of our system as well. In regards to the utilisation of the independent sector, we engaged with them, and we have engaged with them extensively over a number of months, even from the first wave of the pandemic. And again, the biggest challenge that we have working in partnership with our independent sector is the inability to give them a long-term funding commitment. So when we go in to buy services from the independent sector, it is on a 12-month period. We cannot buy a number of thousands of operations or diagnostic tests on a long-term commitment. So the independent sector actually face the same challenges that we do as a health service. If they know we're able to give them £35 million this year, they can utilise it, they can spend it, but they are then under the same staffing pressures that we are. How do you staff up knowing that in 12 months' time our Department of Health may not have the money to keep the services and to keep the staff that they have invested in going? So it's about how we get over that hurdle of the recurrent budget. And this is not a criticism of my executive colleagues. Every one of my executive ministerial colleagues is under the same pressure. But it's the system that we now have that pushes additional challenges on especially those departments that are core staff, and the majority of our funding is actually spent on our staff, like myself, and education as well. So that ongoing need is always there, and it always will be there until we can get over that hurdle, because it's about investment for the future. There used to be a great phrase in politics in Northern Ireland, it was invest to save. There's no more key principle in invest to save than our National Health Service. Invest now in the health of our young people, invest in the diagnostic tests so that we do not get down to the pressures that come in future years, that we can actually get in now and intervene before we get into a worse scenario in regards to increasing waiting lists with more serious conditions actually to deal with and support.
Remember Carol Ní Cullen, I call Carol Ní Cullen.
Gormiagat, Can Colin, Agus Gomboy, his Leshanara, Sockton Righteous. So thank you very much, Mr. Speaker, and thank you to the Minister for his statement this morning. Minister, you'll be aware at the end of January this year, more than 20,000 people are waiting on a neurology appointment, with 13,000 of those waiting over 52 weeks. So my question is, what are you doing to support those people as well? And in relation to mental health services, will that additional funding also include investment into people who have got mental health crises, also addictions, who are commonly referred to as dual diagnoses? Because ask any trust across, they have seen a massive increase. We've seen it in North and West Belfast. So can the Minister ask or answer those questions? Gormagat.
And I think the member, in regards to the challenges we have in neurology, I think are well documented. And again, goes back to the long-term investment of specialists, especially in those critical procedures, those critical areas that we haven't seen for years. We did not invest, there was no succession planning in an awful lot of our specialities that we need to see now, and we need to actually get more investment in. But to invest in a consultant, it takes years to train and to bring on board in regards to a number of those specialities, to attract them from abroad or from elsewhere, needs an attractive package. It needs long-term sustainability, that their post is going to be there, that their staff is going to be there to support them as well. And I think that's one of the challenges that we have seen in neurology, along with a lot of other specialities in Northern Ireland specifically. In regards to the mental health support and post-pandemic, we've seen work already being undertaken in regards to the primary care, our multidisciplinary teams. And it's about how we strengthen those as well, so that we're actually seeing people, in regards to mental health, so we're actually seeing them closer to home. Because that is one of those areas where it can be done. You don't need to be going into a theatre or a diagnostic room. When it comes to some of the funding that we are coming forward in regards to, or some of the announcements I will be making, in regards to talking therapies, supporting voluntary and community sectors, supporting those volunteers that have carried such a heavy load over the last 12 months, that we actually make sure that there is some, and again, short-term funding, because that's all I have. That's all I have in my purse to give, is that short-term, non-recurrent funding that I can give. But it's about making an investment in those people so they can pay back into the communities. The member knows well, if we can get engaged with those people who are starting to struggle with mental health issues, it's about preventing it becoming a more serious long-term issue. It's about preventing that challenge also becoming on their friends and family as well. So it's about making sure, again, that we invest in those community organisations and the voluntary and community sector and support them for what we will need them to do over the next number of years while we combat what will be the challenge coming out of COVID in regards to mental health stresses.
Call Phil McGuigan.
Good, Ceann Comhairle. I welcome the Minister's statement today, and included in it, the Minister has quite rightly identified that staff are essential to the delivery of our health services, and I welcome that one of the 5 principles in his rebuild plan is ensuring that staff will have the opportunity to take their entitled annual leave. I welcome that, but I would add that would need to be the very minimum in supporting and retaining our staff. And following on from that point, if I could ask the Minister what progress has been made with the COVID-19 recognition payment for staff, how many staff have received this award so far?
I thank the member, and I'll tell him none of the staff have received it so far, because one of the 2 commitments, or one of the 2 asks that I was given, was to make sure it was tax-free and to make sure that it did not affect benefits, especially for those, especially on the lower paid basis of our health and care sector workforce as well. So one of the things, in answer to that, when we made the initial announcement, there's been additional work has had to be done and continues to be done. We were, with thanks to the member's colleague in finance, able to increase the package so that that £500 should not incur the majority of the tax implication that it will have. We've also been working with the Minister's colleague in Communities, who has been engaged with her colleagues in the Department of Works and Pensions to see how we can make the payment then such that it won't have an effect on any supplementary benefit payments as well. That is a bigger challenge. It has been a bigger challenge. One of the things in the piece of work we're currently at now is if that £500 was paid over a staggered period for those individuals who are also on income support payments as well, that it would not have an effect on their overall allocation, or it would not have an adverse effect on any of the benefits that they were also gaining as well. So it's a complex piece of work. It's a piece of work that is covering many thousands of staff, not just within the health service but also outside the health service as well. So it has taken more time than I would have liked it to, but I want to make sure that we get as much of that money as possible into people's pockets, the people who have worked for it, the people who deserve it. And it's also working again with our trade union side to make sure that they're on board. One of the asks that they actually made of us was, rather than pay it in piecemeal, try to make the allocation and make the payment to as many people at the same time, so it doesn't cause anxiety for other people who may think then they're not getting it or they're not entitled to it. So it's a challenging piece of work because it's a massive workforce to cover with a number of financial commitments. But, Mr. Speaker, it is one of the pieces of work that I've had full support from my executive colleagues in bringing forward that acknowledgement payment. It's more complicated than it sounded initially, but I want to make sure that people get as much of that money into their own pockets as I can possibly do with working through my executive colleagues.
I call Justin McNulty.
Minister, I'm delighted to say that this morning I got my first COVID vaccination. I was at South Lakes Leisure Centre in Craigavon, and Minister, I was mesmerised by the teamwork, the positivity, the professionalism, the friendliness, the warmth of the welcome, the camaraderie, the organisation and efficiency. It was heartwarming. Major well done to all the healthcare involved, and to the management and to you as Minister for overseeing that deployment of the vaccinations. Special mention to Linda Willis, who put the needle in my arm, and to Sharon Kerr. And, listen, but the most important thing is the energy, the enthusiasm, the teamwork on the show there was incredible. It can move mountains. In relation to your statement, Minister, 570,000 patients waiting for the first consultant-led outpatient appointment for inpatient daycare treatment or for a diagnostic test. That's more than 500,000 people. That's a third of our population. And you talked about it being 5 to 10 years for it to become back to waiting list to get back to acceptable levels. Minister, that's not going to provide much comfort to patients and their families. Can you say anything today that will provide some comfort for those patients and their families?
First of all, I thank the member for his acknowledgement of the vaccine service. I've visited now a number of sites. I got my own vaccine through community pharmacy as well as our GPs who are delivering it as well. I think one of the most emotive visits is to visit one of those vaccine centres. I was in the Ballymena Centre in the Seven Towers Leisure Centre yesterday. The majority of the staff who were on duty were volunteering and were actually working on their off days to deliver vaccines because they see it as such a psychological lift for them and for the people of Northern Ireland. So they're providing part of the relief, part of the way out of what has been a terrible 14 months. And I think the energy, the commitment, the drive of those staff, some who have come back from retirement, some who are trainees. I spoke yesterday, there was physiotherapists, there were speech and language therapists, there was dietitians, all who have come forward to be part of this vaccine programme because they see it as such a positive of our health service that is doing, but also such an emotive one as well. Talking to the centre manager, one of the things that they did not prepare for when establishing it was putting boxes of hankies in each vaccination booth, because what they said, the number of people who burst out in tears because of the relief that they've actually got this vaccine has been immeasurable. one of the more moving, talking to a vaccinator, I think it was in the South Eastern Trust as well, and I've used this story in the House before, Mr. Speaker, when a lady receiving her first vaccine thanked the vaccinator for holding her hand because that was the first human touch she'd had in nearly a year. So those stories, those releases that our vaccines and the vaccinators are getting, I think are immeasurable. And I'm glad the member has got his vaccine, and I'm glad he'll get his second one as well. I would encourage everyone in the House who's in an eligible age group to go forward. I'll try to get to you as quick as possible, John. As is possible, because it is part of the solution. And Mr. Speaker, I want to put on record my thanks to all those people who are working across the system and delivering it. The member thanks me, but there's nobody deserves more thanks and praise than Patricia Donnelly, who has brought this entire process together. In regards to those people who are on those waiting lists, that's what today's statement's about. That's why I'm here today, not sugarcoating this, not saying everything's perfect, not saying we're, another couple of months we'll be back there, because that would be disingenuous and dishonest of me to do that. This is a challenge. What I will say to the people of Northern Ireland is you have a highly dedicated, highly professional health service and people working in it who want to get back to their day jobs, who want to see you as quickly and as efficiently as possible. Now, it will mean changes, and will mean challenges to many of us as politicians. What I've seen in the past year, Mr. Speaker, is a willingness now for our health service, our health staff, to go somewhere else to deliver a service. Belfast surgeons operating in the SWA. 2 years ago, people would have said it would never have happened. People travelling from one side of Northern Ireland to another to get that procedure because they know that's where they're going to get it. Our health service has moved outside that challenge of being local. Many of our patients have moved outside that challenge of getting treated local. And I think the next challenge is for us as politicians to allow our health service to do that on a regional approach, and to allow those patients to get the service and the delivery that they actually need where it's going to be. What I'm now looking at, and I think I've used this phrase many times, is about that regional approach, and that's why we're getting that. And that's why the setup on the service in the Lagan Valley, the orthopaedic spoken hub model that we're setting up. So it's about how we provide a holistic health service to all the people of Northern Ireland on a regional footprint. It will bring challenges, and I think, Mr. Speaker, the biggest challenge it brings is to us as politicians, as to accept that things will have to be done different.
And following on from the Minister, I am very pleased to advise the House that I've actually had my second vaccination this morning in Ulster Hospital, so you can now call me 2 jobs Alec. So I will call Robbie Butler.
Mr. Speaker, it's been a while since you were called 2 jobs Alex. Maybe back in your boxing days, perhaps. But I thank the Minister for his statement this morning, and it is a statement of hope, but you are quite right to tinge it with reality when it comes to funding, Minister. I also welcome the indication of further support to be announced in the coming days, particularly with regard for mental health services, and I thank you, you are the Minister who has put mental health to the fore of everything that he does. Does the Minister envisage that this will further increase the provision of crucial counselling and talking therapy services?
I thank the member, and again, I will acknowledge. I think one of the first initiatives that the executive took was actually establishing the executive working group on mental health, resilience, well-being, and suicide prevention, and that set a tone and a tenure for what we were going to do in regards to mental health, in regards to how we as a department were able to move forward in regards. And I've said this before. No matter how bad the first pandemic was, we moved ahead and launched the mental health strategy as well, because that was something that we'd committed to do. It's something we were going to do, and something that needed to be done. That's why we went on ahead and appointed the first interim mental health champion as well, to make sure that we got mental health and the challenges that it presents, not just to the people of Northern Ireland, but also to the recognition that it needs within our health service, within this place and within the executive, so that it gets the support, both practical and financial and political, that it needs to address many of the challenges that mental health has long faced across Northern Ireland. In regards to the member's specific question in regards to the potential funding, that allocation will be made to, as I said to Ms Nicole, in regards to those voluntary community groups, the charity organisations, those specialist organisations who have experience and knowledge of how to address this at a community level, how to challenge what needs to be challenged and how to address what needs to be addressed. But again, the challenge that I have, the challenge that it brings, is again this funding is non-recurrent, it's not long-term, and that's what puts an additional strain and stress of those people who have already been doing this work and will continue to do this work.
Karen Mullen, call Karen Mullen.
I thank the Minister for his statement today and I agree that time for words of concern has now passed, and I say that as someone who comes from the Western Trust area. On top of all of these legacy issues, we have struggled to attract and retain staff. Minister, I very much welcome the additional funding for carers, charities and organisations, but would like to ask what reassurances can you give to those who have been left to cope in their own homes that statutory respite services will resume in a safe and equitable way?
And I thank the member. In regards to what the phrase he used was attract and attain staff. And again, it puts the challenge back to us as politicians. There's nothing as great as a good health campaign coming up to an election. I remember not long been in this House, Mr Speaker, when a chief executive of a local trust brought me in to point out that one of the things that actually puts pressure on recruitment and retention of staff is for a hospital or a service to be continually in the press with people saying it's going to close. Because nobody wants to move to a service that is publicly under threat, even if it's not in reality under threat as well. It's the same as that old adage, it's never the Education Authority has to close a school, it's only a rumour that a school is going to close and then the parents start to move out pupils. The same as on the narrative that can start very easily around the attractiveness of a facility or the ability to attain staff as well. So it's about that long-term commitment again to the staff and to the footprint as well of what needs to be a regional service. And I applaud some of the examples that we've seen coming from the Western Trust. As I said, the example I used, the ability to use what are excellent facilities in the SWA that for a long term were underutilised, but now I think the majority of surgeons across Northern Ireland would gladly go there because it allows them to see their patients. They know it's appropriate use and a place that can provide that care that they need and the attention that they need as well. So it's about how we make sure that that continues over the next 12 months as well.
Andrew Muir.
Very much, Mr Speaker, and I thank the Minister for his statement. Any statement outlines the waiting lists that are currently there at the moment. I fear that that's just the tip of the iceberg, because I know of a number of people who have been hesitant to go to their GP, whether for putting the health service under strain or the fear of contracting the virus. One of the key ways of dealing with those waiting lists is about financial investment, as the Minister has outlined. What financial allocation does the Minister feel he needs in this financial year to be able to start dealing with these waiting lists? And have any allocations or bids within monitoring rounds been refused thus far?
I thank the member. We're just started into a new financial year. I've currently 35 million in regards to tackling waiting lists, and that's what we've assessed we can use in this calendar year, because it is a calendar year budget, is a 12-month budget. New Decade, New Approach had allocated 50 million for utilisation to tackle waiting lists for the Executive collectively. That was last year's. That money comes, that money has went. We have used it in regards to some of the utilisation of the independent sector as well. But that's where we are in regards to that 35 million is utilisation of the independent sector. But it's a long-term continued investment. It's about improving the services that we currently have. It's about upgrading the theatres, the ICU units that we have currently in our hospital capacities, to make sure that we can progress and process as many operations as we potentially can. We saw, what was a need for a massive number of ICU beds because of long-term COVID patients in those. Currently, we've funded 75 ICU beds across Northern Ireland. As we sit today, there's a number of high 60, I think it's 68, 69 people in ICU beds, non-COVID. So we're already getting to nearly the capacity of our funded allocation of ICU beds. And what COVID has shown us when we've had to escalate up and move into our surge model in regards to ICU beds, that's where we've had to bring staff from across our system in regards to ICU nurses, anaesthetists and all the rest of it. I think that's why yesterday's announcement by the Belfast Trust that I reaffirmed today that the de-escalation now of the Nightingale is such a positive step in regards to be able to utilise that facility, making sure it's a green list site for a regional approach for those more complex operations as well. So it's all about how we get that challenge and getting all those pieces to fit. As I said earlier, we've seen the breaking down of those silos. It's now making sure that they actually produce as well. So in regards to bids and funding, we're in the early days of this budget in regards to what we will need to spend and what we can spend. But it's about a recurrent budget. It's so I can give surety to our staff, to our hospital trusts, but also to the independent sector, that the commitment, that the ask that we're making today will be still there in 5 to 10 years and they will still be getting that financial support.
Cathal Boylan.
And I welcome the Minister's statement. And Minister, I do believe you're serious in tackling the waiting list, but I'll ask the question in this context. In the statement you talk about a reasoned approach to the prioritisation of surgery and the use of independent sector to restart services and reduce waiting lists. So if we're serious with waiting lists, does this regional approach include the utilisation of cross-border services? And what discussions have you had with your counterpart in the South about a regional approach and cross-border approach in addressing these issues?
I think the member part of the independent sector that we are currently engaging with and have utilised and will use is the independent sector in the Republic of Ireland. So it's where we can get a service at all. The Republic of Ireland has its own waiting list, as I'm sure the member is fully aware. So any illusion that they're going to accept patients from the Northern Ireland for the accept to simply reduce our waiting lists, I think is a non-reality, because their focus will be, but it is about using the independent sector in the Republic of Ireland as well as elsewhere that we can actually utilise and get people to be seen quicker as is possible. But there also is those cross-border initiatives that are still being used, still are utilised. Children's cardiac services, where the majority of our children who now need heart surgery are being seen in the Lady of Lourdes in Dublin. A great initiative. The cancer services that are provided for the entirety of the North West, in Donegal, as well as Londonderry, that are being seen in Aldnagelvin, and the number of patients who are being seen there as well. A memorandum of understanding now in regards to kidney transplants between our Belfast Trust and the Beaumont Hospital in the Republic of Ireland. So it's about all those services that we can deliver cross-border, and again to utilise the specialities that are on either side of the border, but for the ability to simply utilise the health service in the Republic of Ireland to address our waiting list is not a reality, but the utilisation of their independent sector and independent service is something that we are engaged with and will use.
Call Mark Durgan.
I thank the Minister for his statement. I very much welcome it. I was wondering, could the Minister give his view on what I view, and many do, as what has been really an entrenchment of a two-tier healthcare system. Those who can afford to go private will do so. Those who can't will languish on lists, and while their physical and mental health deteriorate, many will actually get in debt to pay for treatment. Are there any steps that can be taken to eradicate the perverse practice or situation where a consultant at a hospital can tell someone that they'll have to wait 4 years for an operation, but if they're willing to pay and come private, it'll see them next month?
The member highlights what is the duality of our health service in Northern Ireland, and one that I mentioned does challenge me. I think one of the core principles and one of the things that I hold dear as a unionist is our National Health Service. Free at the point of use, free at the point of delivery, free at the point of care, irrespective of what your financial ability to pay or need is. But what we have seen is, due to that underinvestment over the long-term period in regards to both service and staff, that the independent sector is there. It is meeting the need that people can afford to pay. And it's as simple as that. What we need to do, and what my statement is about today, is actually investing in our National Health Service, investing in the people who work in it, invest in the footprint, invest in the equipment, invest in the diagnostic equipment, invest in the theatres, so that the demand on the independent sector isn't as great, or the opportunity for the independent sector isn't as great. But the reality is that due to the underinvestment in our National Health Service over the last 10 years, the independent sector is there. It's meeting the need. If surgeons are able and capable of working in both systems, I'm not in a position to prevent them doing that, because what we've actually used is those same surgeons in regards to bringing down our waiting lists. When we invest, when we utilise, when we take procedures from the independent sector that we need, is about meeting the demands of our patients as quickly as is possible.
I call Rosemary Barton.
Thank you, Mr. Speaker. Thank you, Minister, for your statement. Minister, I welcome the very successful rollout of the regional day procedures that have happened at Lagan Valley Hospital and the ongoing utilisation of the lists at the South West Acute in Enniskillen. Do you, Minister, believe that compared to only a short time ago, there's now a new outlook, not only from patients but also from clinicians, that people are prepared to travel slightly further if it means receiving or delivery treatment much sooner?
And I thank the member. The member mentions the SWAL we've used, and I thank her for the invite. It seems a long time ago when we went down and visited the SWAL in one of the COVID centres in her constituency as well. But it is about that challenge. And as I said to an earlier answer, we have seen those professionals, those healthcare staff, willing to travel. And it's not just surgeons, it's the entirety of the team, the anaesthetists, the ICU nurses, everybody who makes up that surgical delivery are now willing to travel to get access to theatre capacity and recovery beds and ICU beds for their patients, because that's very much how our health service and the professionals in it see it. They see people as their patients. People are now willing to travel as well, because in realistic terms, Northern Ireland is not a big place, especially if you're needing a surgical procedure. People are now willing to travel, so we've seen that. We've seen that now, and as I've said in an earlier answer, the challenge now is no longer to the health professionals. The challenge is now no longer to people willing to travel. The challenge is to us, just to politicians, as to let the clinical demand be met by the clinicians who are able to deliver a service no matter where it is, on a safe site, through the green lists, through a regional priority, so those who are most in clinical need are seen quicker rather than the postcode they actually live in or want to be treated in. But what we also, I think, have seen, and it's one of the outworkings of this pandemic, is that breaking down of silos across the entirety of our health service, from primary care to our hospitals to community pharmacy, to everyone working across the healthcare family, have really come together, pulled a resource that I think will serve Northern Ireland well, because they want to get back to do the day-to-day work that they do, which is seeing patients and treating patients.
Colin McGrath.
Very much, Mr. Speaker, and I thank the Minister for his statement today. Going back to the remarks that he made earlier about staff not wanting to apply for jobs because there can be rumours about hospitals closing down. Likewise, the removal of services from hospitals and quiet buildings also can fuel that. Could I ask the Minister for a commitment that the full estate of the health service will be used in addressing these trust rebuilding plans and dealing with the problems that we have, and that facilities such as the Down Hospital in Downpatrick will be used to their fullest capacity, ensuring those jobs and attracting jobs in the future as a thriving centre for health?
I've said before that we will need every square footprint that we have to utilise. It may not be providing every service that it has in the past, because that is the challenge about that regional approach, is if you can put an orthopaedic surgeon in one centre and see more patients than having 3 orthopaedic services doing a lesser degree of work, in a number of other capacities as well. You know, and I thank the member for his commitment, because I believe it's some of his councillors who have actually started the campaign for a long-term commitment to the Down and the Daisy Hill. And again, it's that sort of language that then unnerves staff as well, because there's nothing more unnerving than social media campaigns for the people who are working in our health service at this minute in time about saving their hospital, when their hospital is not under threat. So I would ask the member and some of his party colleagues to step away from the party political campaigns and actually looking to support the staff who are working in it and the entirety of the service that has been delivered in those facilities as well. Because, as I've said, we don't have enough staff. We need more staff, so there's nobody going to be done away with. We don't have a big enough footprint, so we need every square foot that we have. But it may not be that everybody gets every service that they want delivered on their doorstep. That has to be the reality if we're to address the waiting lists that we're talking about here today. It has to be also about the political commitment of all in this House, that they are committed to Bengoa, they are committed to all the other reforms that have been talked about. Now is the time to actually implement those changes and stop talking about them. We had a 3-year period where we were unable to make the challenges and the transformations that needed done. Now is the time, coming out of this pandemic, is to serve the people of Northern Ireland by addressing all their health needs equally and equitably.
I call Jim Allister.
Thank you. I hear what the Minister says about tackling waiting lists, but I've been in this House 10 years. I've heard every successive Health Minister make similar affirmations, and yet we are where we are. And during those same 10 years, indeed during the entirety of devolution, what we have done, we have seen almost 2,000 beds and all the necessary staff that goes with them removed from our health service. So what reason is there to believe that today's affirmations are going to be any different? And does the Minister have the confidence that this is an executive prepared to reverse that disastrous policy that denoted each previous executive made up of the same parties?
I thank the member, and I've been in this House as long as him. I think we come in on the same election. I think the difference the member has is that I'm standing here now. We took this position where many other parties in this House passed it. We took this position because we know there is a job of work to be done. In regards to the number of decreasing beds that the member refers to, that's commensurate with the decrease in investment in staff that we've seen as well. There's no point of buying a bed if you don't have the staff to support it. So it's the same process that the member said. And you know, he listened to my statement, I'm sure in detail, where I highlight that our need is the investment in our staff. There's no point of having the facility if you don't have the person or the people to look after the people who need the care. So it's about that investment now. We've started that investment with our 300 trained nurses this year, next year and the following year. It's not enough. It'll not recoup the losses of years of our wrong policy in regards to that de-investment in our National Health Service. The Health Service was one of those things that was seen as easy to cut money from because it made up nearly 50% or more. It's not easy to do it, because once you do that, the easy place, the challenging place, because the Department of Health relies on a major expenditure is on staff, that's the first place that the cuts are looked to. You know, should it be from nursery, bursary placements, to staffing training places, to nursing training places. That's why the safe staffing investment that I mentioned in my statement is so critical. Up until now, up until a few weeks ago, that was being hived off into a budgeting monitoring round bid. It is now there, it's now secure. That's what I argued for, that's what I got, to make sure that we can put that investment into our safe staff. So we increase our bed numbers when we increase our staff numbers, and that allows us to challenge the waiting lists that we have as well. So the member knows me well enough. I'll not come here with empty promises, empty platitudes. Today's statement, I could have flurried the whole thing up and told everybody it was going to be great tomorrow. I didn't. I told everybody the challenges that we have, both in the health service but also politically in this House. And it isn't just about the executive parties getting behind me as Minister of Health or getting behind the health service. It's about everyone in this House getting behind the health service and those who work in it. And I know the member has that at his heart. And I know how much he writes to me and the number of cases that he raises with me in regards to his own constituents. So I asked him to support me politically as well, both in this House and outside this House, in regards to the work and the challenges that I need to do.
Can we bring Jerry Carroll on screen, please? Can you invite Jerry Carroll to put his question?
Thanks, Mr. Speaker, and thanks to the Minister for his statement. I'm concerned that there appears to be a continuation of relying on the independent and private sector to tackle waiting lists. But I wanted to ask the Minister what efforts are being made to increase the number of staff that we have. We are understaffed, as he stated. Before the pandemic, we had 2,000 to 3,000 nurses short. So what efforts are being done to increase the amount of staff in our health service, and specifically what work is he doing with his executive colleagues to remove the barriers that currently prevent people who are refugees or asylum seekers who have healthcare training, who are trained nurses and other healthcare workers but cannot work due to the racist and reactionary immigration policies that we currently have? Thank you.
I thank the member. Racist and reaction policies I don't think are something that sits within my department, nor as an approach. Actually, in the community pharmacy where I received my vaccine a couple of weeks ago, there was a pharmacist from Romania who had just recently come to Northern Ireland and got on the accreditation, certification and professional list, and she was actually working in that pharmacy delivering vaccines because she was a trained vaccinator. So it's not about that reactionary approach. The member will well know in regards to the international recruitment of nurses, which continues to be progressed by my department to make up much of that skill set that has been lost, because it takes time to train a nurse. We need to fill those slots now, so the international market is somewhere where we have been proactive, somewhere we intend to keep working as well to fill many of those slots. But to simply fill nursing positions overnight is not possible. I can't net nurses. They have to be trained, they have to be invested in, and they have to be recruited. And I'm actually thankful for the support of the executive in regards to those additional places that we did secure when this place was restored and restored over a year ago, because that commitment was vital. It was unfortunate that we actually got to ourselves in a place in Northern Ireland where our nurses and our health and social care staff actually had to take to the picket lines to indicate the reality of how underfunded this health service had been over the past 10 years. But it's something that we need to address now, and something that I'm intent to put in right by all the support of all the members in this House.
Thank you, and I call Pat Cadney.
Thank you, Mr. Speaker. Thank you, Minister, for that statement today. And I, for one, will be supporting you. I know how difficult it is, and the policy is not in my backyard. But when I applied for my vaccine, I went to Ballymena. It was the first place offered, and it was efficient and everything about it. And Mr. Speaker, I have my little card like yourself to say that I've had 2 vaccinations, and I know my features are a little bit more rugged than your own. And if you want to be known in the boxing arena as 2 jabs Alec, I'm going to be known then as 2 pokes Pat, just to try that out. But on a really serious note, Minister, I look at the work which is ongoing in Lagan Valley Hospital at the moment, and that old Victorian facade and how it opens out. And I also was treated in the Day Procedure Centre there. I congratulate the department and the trust for the work on the Day Procedure at the Lagan Valley. Minister, will there be an overall assessment of the increased amount of visitors to the hospital, and how will this impact on the traffic and the parking issues which we're having there along the Hillsborough Road? I know it's great to welcome what's coming in, but we have to look at how successful it is, and we need to look at. I'm asking you, will you call for some sort of an investigation into parking around the hospital?
I thank the member and I congratulate him on getting his second job as well, and travelling to Ballymena to get that as well. So it's a double bonus for the member. But what I will say in regards to the parking issues around the Lagan Valley, in regards to that, is something to look at. It's something that hasn't come across my desk before now, but now the member has raised it. I will raise it with the Trust and see what can be done.
Members, that concludes questions on the statement, and could members please take a raise for a moment or two?
Order members, the next items of business are motions to approve 2 statutory rules which relate to Corporate Insolvency and Governance Act 2020. There will be a single debate on both motions. I'll ask the clerk to read the first motion and then call on the Minister to formally move it. The Minister will then subsequently commence the debate on both motions as listed on the order paper. When all who have wished to speak have done so, I will then put the question on the first motion. The second motion will then be read into the record and I will call the Minister to move it. The question will then be put on that motion. If that is clear, we shall proceed. Clerk, please read the first motion.
That the Corporate Insolvency and Governance Act 2020 Coronavirus Amendment of Relevant Period in Schedule 8 Regulations Northern Ireland 2021 be approved.
I call on the Minister for the Economy to formally move the motion.
I beg to move, Mr Deputy Speaker.
Thank you. And the Business Committee has agreed that there will be no time limit on this debate. And I now call on the Minister to open the debate on the motions.
Thank you, Mr Deputy Speaker. I am seeking the Assembly's approval of 2 statutory rules which are being made under powers contained in the Corporate Insolvency and Governance Act 2020. The overarching objective of the Act was to provide businesses with the flexibility they need to continue trading during this difficult time. The measures were designed to help companies and other similar entities by easing their regulatory burden and helping them avoid insolvency during this period of economic uncertainty. The Act introduced greater flexibility into the insolvency regime, allowing companies an opportunity to explore options for rescue so that they can have the maximum chance of survival. It also temporarily suspends parts of insolvency law to help directors continue trading through the emergency without the threat of personal liability, and to protect companies from aggressive creditor action. Mr Speaker, the pandemic has had a longer and deeper impact on the economy than had been envisaged when the legislation was passed last summer.
The regulations which I am asking you to approve today are the latest in a series of statutory rules which I have presented to the Assembly, which extend some of these temporary provisions. The first statutory rule is a set of regulations to extend the period during which Schedule 8 of the Act applies, from the 30th of March 2021 until the 30th of September of this year. These regulations were made on the 9th of March and must be approved by the Assembly within 40 days of that date. A new moratorium procedure established by the Act gives companies in financial difficulty the opportunity of a breathing space free from creditor pressure to explore options for rescue. Schedule 8 of the Act facilitates easier entry into the moratorium during the coronavirus crisis by temporarily relaxing some of the eligibility conditions. It also contains a set of temporary administrative rules that are needed to work with the primary legislation until permanent rules can be made. The second statutory rule also takes the form of regulation. The purpose of this rule is to keep in place until the 29th of April 2022 a general power that allows my department to make temporary amendments to corporate insolvency or governance legislations for reasons relating to the effects of coronavirus on the business or the economy. Providing for temporary legislative change in this way will mean that the insolvency and business rescue regime may quickly react and adapt to deal with significant and unexpected future challenges presented by the impact of the pandemic on businesses. Temporary amendments to legislation may be framed to give protection to companies which would be viable but for the effect of the pandemic, and to provide the regulatory support needed for their survival rather than being forced to enter insolvency proceedings. This power, which had been due to expire on the 30th of April 2021 this year, has already been used to replicate legislation made in the rest of the United Kingdom. Mr. Deputy Speaker, I consider it prudent to keep this general power for a further limited period. It will provide my department with the flexibility to respond quickly to any urgent or emerging issues that will help local business owners to avoid insolvency and trade through the current crisis. The content of these two sets of regulations and the dates to which the provisions are being extended correspond to what is being done in the rest of the United Kingdom. Both sets of regulations have been agreed by the Economy Committee, and the Executive was advised prior to the debate. Mr. Deputy Speaker, to conclude, it is essential that measures to assist companies that are struggling financially as a result of the pandemic are kept in place for as long as is necessary. It is vital that local business owners are afforded the same easements and for the same periods as the rest of the United Kingdom. The extensions to be made by these two sets of regulations are therefore there to ensure that this happens. Thank you.
I now call the Chairperson of the Committee for the Economy, Kiva Archibald.
And I rise to speak just briefly as Chair of the Economy Committee to support the motions on its behalf. As the Minister has indicated, the amendment of relevant period in Schedule 8 regulations extend the period during which the Department can exercise its power to make regulations under Section 28 of the Corporate Insolvency and Governance Act 2020, which amend or modify the impact of corporate insolvency or governance legislation. The Committee considered and approved the SL1 for the regulations at its meeting on the 3rd of March, with members agreeing the SR itself at the Committee's meeting on the 23rd of March 2021, subject to the Examiner's report. On behalf of the Committee, I support the motion to approve these regulations. As the Minister has indicated, under Section 32(1) of the Act, the power which the Department or the British Secretary of State has to make regulations under Section 28 is set to expire on the 30th of April. Section 32 includes provision to make regulations which substitute a later expiry date for the one currently specified. It specifies that the new date has to be in within the period of 1 year from the current date and must be within the 2-year period following the date on which the CIG Act was passed, i.e. the 25th of June 2020. The committee considered and agreed the SL1 for the draft regulations at its meeting on the 23rd of March 2021. However, the committee has not considered the draft regulations on the order paper today. It is scheduled to be considered by the committee at its meeting tomorrow. Therefore, as the committee has not considered the statutory rule, I am not able to support the motion on its behalf. The committee has no view, and on that basis I will not be opposing the motion. Just, I suppose, to make a couple of comments as Sinn Féin economy spokesperson as well. This is, these two SRs are a number, as the Minister has referred to, being made in respect of the Corporate Insolvency and Governance Act that we have supported, because obviously businesses need the flexibility to be able to respond, and we're very cognisant of the impact that the restrictions is having on businesses, and the crisis has continued a lot longer, I suppose, than many of us had originally anticipated and that this legislation had anticipated, and therefore we continue to support these extensions to give businesses the ability to respond and to give the Department the ability to respond appropriately as well. So, Garmelga, last Concordia.
I now call Christopher Stilford.
Thank you very much, Mr Deputy. On behalf of my own party, I want to welcome the actions that the Minister, and her party actually, I want to welcome the actions that the Minister has taken today in bringing these motions before the House. These measures are clearly designed to enable companies to operate under the strictures that have been placed upon them through the various COVID-related restrictions that this House has passed. And I think it's important that we do that in order that we can protect businesses and companies and to allow them to trade once this period of time passes, so that they're in the best possible shape to do so. It is my sincere hope that this will be the final time that the Minister has to come to this House in order to seek approval for such measures, because it is my hope and my conviction that the Executive should be doing all in their power to open up as much of our economy as possible in order to allow our people to get back to work, in order to stimulate economic growth, and in order to create prosperity. So, as I say, hopefully, and I'm sure the Minister would agree with me on this, hopefully this will be the final time that she will have to come to this House to seek support for such measures, and we can get back to work in Northern Ireland. Thank you, sir.
I now invite the Minister for the Economy to conclude and wind up the debate on both motions.
Can I thank you, Mr Deputy Speaker, and thank you to those who have indicated their consent to the making of these statutory rules. And can I say to my colleague, the economy has gone through a very dark period due to COVID-19 and the restrictions that have been placed on the economy. I do look forward to that time when we are rebuilding and recovering our economy, and that this is indeed in the very, very near future, and that this will be the time that such restrictions and regulations are needed. Can I say thank you?
Members, the question is that the Corporate Insolvency and Governance Act 2020, Coronavirus, Amendment of Relevant Period in Schedule 8, Regulations NI 2021 be approved. All those in favour say aye. Aye. Contrary, no. I think the ayes have it. The ayes have it. The ayes have it. We will now move on to the second motion on the Corporate Insolvency Governance Act 2020 regulations, which has already been debated. I'll ask the clerk to read the motion.
That the draft Corporate Insolvency and Governance Act 2020 Coronavirus Change of Expiry Date in Section 32(1) Regulations Northern Ireland 2021 be approved.
I now invite the Minister to move the motion.
I beg to move.
The question is that the draft Corporate Insolvency and Governance Act 2020 Coronavirus Change of Expiry Date in Section 32, Part 1, Regulations NI 2021 be approved. All those in favour say aye. Contrary, no. The ayes have it. The ayes have it. And I would ask members to take their ease for a few moments as the Minister takes a seat. Point of order.
Deputy Speaker, can I apologise to the House and to the Minister for the rude interruption of my phone? If I could only be silenced as quickly as the mute on my phone, some would probably think that that would be of great benefit to many people. So apologies to all in the House concerned. Thank you.
And I thank the member for acknowledging and recognising the error, and I would ask that all members take care and ensure that their phones would be on mute. I'd ask members to take their ease for a few moments. Order members, the next item of business is the introduction of the Horse Racing Amendment Bill. And I call the Minister for Agricultural, Environment and Rural Affairs to move the first stage.
I beg to move the first stage of the Horse Racing Amendment Bill.
A bill to amend the Horse Racing Northern Ireland Order 1990 to allow for payments to be made from the Horse Racing Fund to horse racecourse operators and for connected purposes.
And that concludes the first stage of the bill, and it shall now be printed. Again, I would ask members to take their ease for a few moments before others will be joining us for question time. Order members, it is now time for questions to the Minister of Agriculture, Environment and Rural Affairs, and I call Doug Beattie.
Question 1, Mr. Speaker.
As you may be aware, customs formalities are not a devolved issue, though my department has been liaising with HMRC in order to seek clarity on these issues. The HMRC advice states that for fish caught in the UK territorial waters, the EU's view is that there is need for customs and regulatory requirements, including the submission of safety and security declarations by the fishers on each landing, which potentially means that there is the need for additional control for the landing of goods, that is fish, at Northern Ireland's fishing ports, which would be extremely burdensome and totally unworkable for most of the smaller vessels, as some of these requirements mean they have to land in a port under customs control,
which may be a considerable distance from their home port. The UKG has provided us with a different legal interpretation on these customs formalities, and have advised that Northern Ireland vessels will only be required to meet pre-existing obligations such as those contained within the Fisheries Control Regulation when landing into ports in Northern Ireland until further notice. This is in line with the approach taken to the implementation of the protocol more broadly, where there is the need for pragmatism as traders and fishers adapt to new requirements. The UKG have assured me that they would robustly defend this approach should any challenge to it be raised by the European Union, though it is important to note that this has been the subject of engagement between the UK and EU during the course of joint committee proceedings. It is accepted that this approach will require further discussions with the EU. However, the UK's position is clear that Northern Ireland vessels should not be subject to any new customs requirement until further notice. However, my department has been working through a number of Northern Ireland Protocol issues in the recent UK-EU negotiations that relate to fish being landed in Northern Ireland ports by NI-registered vessels, 2 of which have been successfully resolved through these negotiations. The outstanding unresolved issues relate to illegal, unreported and unregulated regulations, and this issue on the application of the EU customs formalities on the fish landed by our vessels into our ports. I have been pressing the UKG on these matters since early last year,
The Minister's time is
where I
up.
have made it clear that my desire was to have a carve-out of these obligations similar to what was provided in the SPS and tariff issues through the negotiations.
And can I remind the Minister that there is 2 minutes, and if he requires additional time, he can request an additional minute. I call Doug Beattie for supplementary.
Minister, thank you for that very fulsome answer, and I absolutely appreciate that this is something outside of your control, and I know that you're working hard on this, but you will agree with me that it is absolutely ridiculous that water around Northern Ireland can be classed as a third country for our fishermen to go into. It's one of those ludicrous aspects of the protocol. But slightly on a side issue, Minister, can I just ask you, and this is a spin-off slightly to that, what influence can you have to make sure that Northern Ireland fishermen get their full quota from the new quotas system in regards to the extra fishing quotas post-Brexit?
In relation to that, obviously I wasn't happy with the deal that was initially arranged by the Prime Minister and the European Union, and that I believed that we should have obtained much greater volumes of quota than should have been the case under Brexit, but that the UK government settled for something less than that, although we will be revisiting that in 2025. However, in terms of the quota as it was awarded, we had extensive discussions and correspondence with UKG on this matter. They have arrived at the circumstance that they have arrived, which didn't give us the uplift that we would have wanted, albeit we have on average a 10% uplift across the fleet. So in that respect, the fishermen are considerably better after Brexit, but it could have been much better than that again had a tougher deal been negotiated with the European Union by the UK government.
I call Martina Anderson.
Minister, given the devastating impact of Brexit on fishing men and women, what exactly is the current position for fishing vessels that are going from the north to the south and vice versa?
Well, first of all, I don't accept that it's a devastating impact for fishermen as a result of Brexit. As I indicated, they will be able to catch more fish, and were it not for the COVID situation, then the value of those fish would be considerably higher than is the current situation. As the member is probably aware, there was an agreement between ourselves and the Irish Republic, the Voisinage Agreement, and under the Fisheries Act 2020, all EU vessels fishing in UK waters must be licensed by the UK. Similarly, UK vessels fishing in the EU waters must be licensed by EU. And the reciprocal access to the Ireland and Northern Ireland 0 to 6 nautical mile zone under the existing Voisinage Neighbourhood Agreement means that we must license each other's vessels. and this is something that is being progressed urgently. Vessel lists have been exchanged and we are waiting on confirmation that licences will be issued to Northern Ireland vessels before we can respond. But we are very keen to ensure that Northern Ireland fishermen can continue to fish in Irish waters and that Irish fishermen can continue to fish in the UK waters. Under the previous agreement, it worked extremely well, and if there's any holdback in that, it's not coming from the Northern Ireland side.
I call Justin McNulty.
Thank you, Minister, for your answers thus far. Minister, what's your assessment of the additional quota allocated to the local fishing industry as an outcome of Brexit?
Better than it was before Brexit, but not as good as it could have been had a tougher negotiation been adhered to by the UK in terms of regaining the waters that we have been deprived of for many years. So the opportunities that exist are not what they could be, but I would hope that we will take the opportunities that exist now and that in the future negotiation we will gain considerably more opportunities for our fishermen.
Moving on, I call Gemma Dolan.
Question 2.
In 2018, DAERA undertook an engagement exercise gathering a broad range of stakeholder views on future agricultural policy. Those views and future stakeholder engagement have been central in developing my vision for future agriculture in Northern Ireland. My department is now at an advanced stage in the development of a draft policy framework portfolio, which I hope to publish in coming months. The framework has been defined around the 4 key outcomes of increased productivity, improved resilience, environmental sustainability and improved supply chain functionality. We will continue to engage with our farmers and land managers and our environmental stakeholders to co-design new agricultural policies as this work continues into the years ahead.
Gemma Dolan for supplementary.
Thank you, and I thank the Minister for his answer. Minister, can I ask you to outline your intentions regarding the issue of entitlements? Is this a policy that you'll continue into the development of a future agricultural policy?
Well, I want to engage with industry and indeed with the Assembly and the Assembly Committee on these issues before I arrive at any fixed positions. What I do think is that we should have a fit-for-purpose agricultural payment policy. It's something which we need to reflect on in terms of the whole climate change policy as well, and ensuring that those farmers who may have to lose some of their land which has been available for grazing because we wet peatlands, etc., are adequately compensated for that. We need to look at the support that is provided for hill farmers in particular to keep suckler cows and sheep and ensure that those hills are well utilised. We need to consider whether we want to support suckler cows in lowlands or whether, because of sex semen, for example, that the beef would be coming from the dairy herd and therefore there isn't a requirement that we would be wanting to incentivise farmers to keep sucklers on lowland. But these are all issues for discussion and for debate. I don't have fixed positions on them at this moment in time because I think it would be wrong to do that before we identify what the public's views are and indeed what this Assembly's views are.
I call Rosemary Barton.
Thank you. Thank you, Minister, for your answers so far. Minister, have you determined a change in the departmental policy on the final decision-making of the DAERA appeals process yet?
Well, it would appear that legally it ends with the Minister, but I've made it very clear that this Minister has no intention of overturning the views that have been expressed by an independent panel. Unfortunately, that wasn't the case for many, many years, and quite a number of appeal cases that went to the independent panel were overturned. That's something that I disagree with. There's no point in having an independent panel and then the Minister being lobbied by officials and overturning the views of the independent panel. In my view, it is a much fairer process. If someone goes to an independent panel, they make their case, they make their arguments, it is accepted there, that the Minister would accept the case that has been provided by that panel.
I call John Blair.
Thank you, Deputy Speaker. Can I ask the Minister if future agricultural policy will involve significant further investment in sustainable farming systems, as these would be key to not just a COVID recovery but also a green recovery?
Yes, absolutely. And I have asked my officials to work up a bid to the Department of Finance, because if we are serious about climate change, we need to recognise that it is going to involve significant investment. And we will be seeking the Department of Finance to support us in making that significant investment, in supporting the farming community in particular to make that investment, where they can engage in activities which will significantly reduce the carbon footprint, which will engage in carbon capture, and that is a course of work that is absolutely critical that we work across the executive on.
I call Pat Simglone.
Thanks very much, and thanks very much to the Minister for his answers. There have been a number of threads that we've been working through there in the responses to that. Can the Minister confirm, will there be a specific bill tailored for Northern Ireland? He mentioned a number of policy areas that were to be looked at. Will there be a specific bill for that purpose?
Be a decision for the new Minister or the next Minister, whoever that happens to be after the election. I don't think that we will be, time-wise, capable of introducing an agricultural bill in the lifetime of this Assembly, which is running to May 2021, or 2022 rather.
Moving on, I call George Robinson.
Question 3, Mr Deputy Speaker.
My officials have confirmed there is no further update at this time following the information provided pursuant to AQW 1099/17-22 and your Freedom of Information request DERA/20-334 received on the 12th of December. My officials have confirmed again that the project in question relating to the reinstatement of the hydroelectric scheme at the Roe Valley Country Park cannot be completed until such time as permission is granted by an adjacent landowner for access onto their lands in order to allow works to proceed. As previously advised, Department officials have confirmed a comprehensive proposal has already been made to this adjacent landowner through their legal representatives, and whilst officials have been notified that the landowner in question considered this proposal unacceptable, departmental officials are still awaiting specific details as to what elements of the existing proposal they are objecting to. The landowner concerned is aware of this. To date, no further contact has been received by officials from the landowner in question, or indeed an appointed legal representative as regards these details.
I call George Robinson for supplementary.
Thank the Minister for his answer. Minister, I fully appreciate that there is a long-running difficulty with this project, which has caused the adjacent landowner great distress, and physically and mentally, since 2013, and according to Freedom of Information, which the landowner has sought so far, has cost the taxpayer quite a lot of money. Minister, could you undertake to see if a speedy resolution could be found to bring this worthy project to a conclusion in the interest of everyone? And could I ask if a site meeting or an online meeting with department officials, landowner, yourself and I would be acceptable?
On the latter part, I can't give you a specific answer because obviously this has been dealt with through the Departmental Solicitor's Office, and the landowner has their own legal advisors. So I'm not unwilling to do it, but we will await advice on it. I recognise that it is a project which is very worthy and one which we want to take forward, but we need the cooperation of the landowner. And if the landowner have issues, then we need to identify what those issues are and see if we can reach agreement with the individual.
I call Mark Durkin.
Thank you, Mr Deputy Speaker, and I thank the Minister for his answers thus far. The intrinsic value of our country parks, open spaces and forests has been amplified over this past year. Will the Minister commit his department to continuing work with Derry City and Strabane District Council to facilitate the repair or reinstatement of the footbridge in Muff Glen Forest just outside Eglinton that was destroyed by floods in 2017, making this tremendous asset more accessible and increasing the number of people who can enjoy it?
I believe that's beyond the Roe Valley, but the Minister may wish to respond.
I'm unaware of the particulars of the case. I wasn't forewarned of it, but in any event, we have been working closely with councils across Northern Ireland to improve our forest parks, and we have seen some fantastic projects carried forward where DAERA has supported local authorities, and it has really improved access both for families and disabled. And we're happy to look at the issue that's been raised by the member around Muff Glen.
Moving on, I call John Stewart.
Received a portfolio of documents on the Island Magee gas storage proposals. My department is a competent authority on the marine licence, and I am also considering a review documentation for the 2 other DAERA licences that were issued back in 2014, a water discharge consent and a water abstraction licence. The documentation is comprehensive and will therefore take some time to be considered fully.
Call John Stewart.
Thank you, Deputy Speaker, and I thank the Minister for his response on that. The Minister will be aware that the gas caverns project has been and remains very contentious, particularly on Island Magee. I'd be interested to get more detail of the advice he's received, both on the full marine licensing review and the abstract licence and consent to discharge. And is he minded, on the back of legal advice, to refer this to the Executive Committee, and will he support calls to instigate a local public inquiry?
Well, in respect of this, I have only received the documents, and therefore I will be giving them full consideration before making a decision. I recognise that the proposed development is unpopular with some of the local residents, and that in itself does not mean that it's controversial in terms of legislation around executive referral. Whilst it may be controversial locally in terms of the measures for a minister to have to take it to the executive, it doesn't necessarily mean that it's controversial. But I can assure you that I'm considering the option of executive referral, and I'm also mindful of my duties under the Ministerial Code, and in terms of the option of holding a public inquiry. As you can appreciate, I'm unable to comment further at this stage until I have that full consideration taken.
I call Stuart Dixon.
Thank you, Minister, and thank you for the answer which you've given to my colleague from East Antrim. Would the Minister agree with me that a public inquiry is inevitable, given the outcry that there has been in respect of this particular project, and that indeed it is a cross-cutting matter for the Executive and not one solely for his department?
Well, in terms of it, we have our scientists who have been working on this and identifying the issues, and public inquiries would be called on the basis of facts, not noise. And whilst I sincerely appreciate the concerns of residents, it's a very pleasant area, a beautiful area, right out to Browns Bay there. It's one I go to on occasions. And I appreciate the beauty of that area, and therefore the local residents will want to keep it as it is, and therefore all of these things have to be given the full appropriate consideration. I will probably be in a situation where this has a huge potential to be judicially reviewed by either the applicant or indeed the residents, whichever decision I make. So therefore I have to be very careful what I say, and I have to give this my absolute careful consideration before arriving at a decision. But we do have papers, and progress is being made in terms of arriving at a decision, and that is something for us to work on at this stage.
I call Kiva Archibald.
Margaret, last Concordia, and I thank the Minister for his response. Does the Minister agree, in light of his own recently published proposals for the Climate Change Act and also the Green Growth Framework, that it's inappropriate to proceed with further investment in fossil fuels rather than focusing on meeting our renewable targets? Margaret.
It certainly is a consideration. Energy lies within the Department for Enterprise, our Department for the Economy, and we have been looking to receive advice from them on what their future expectations is. Gas is a clean energy, but it is still a fossil fuel. But it certainly has a much lower impact
than coal or oil. And consequently, if it is identified that gas will be used for a considerable part of the foreseeable future, then that would lead you to a point where the gas caverns are something which would be beneficial from the energy point of view, not necessarily from the environmental point of view. However, if the energy is pointing to providing the energy resource from other means, as opposed to gas, and a significant upgrade in renewable energy, then that would take you away from the gas caverns. I should say that the Department for Economy has set 70% for renewable energy by 2030. Going beyond that, we would need to be developing widespread, large-scale offshore electricity generation, which takes about 10 years to plan. So that is an issue which will in itself have its own controversies. So whatever you do in all of these areas, there is going to be a degree of controversy, and we need to respond to it.
I should have advised members earlier that question 7 has been withdrawn. I now call Maurice Bradley.
Thank you, Mr Deputy Speaker. Question 5.
There's an increasing acceptance that the Northern Ireland agri-food industry requires a more assured supply of veterinarians than is available from the existing sources. However, there are a number of possible options for meeting this need. In my absence in early March, Minister Gordon Lyons met with the Vice-Chancellors of the University of Ulster and Queen's University Belfast. Minister Lyons proposed an analysis of the options for the supply of veterinarians and a more detailed consideration of the various delivery models, structures and locations to inform a business case for the facility for veterinary education in Northern Ireland. It was agreed with the 2 university Vice-Chancellors that the Strategic Investment Board would be asked to carry this out as soon as possible. The Strategic Investment Board is now commissioned to undertake this analysis, which will go forward with input from staff from the 2 universities and the support of the DAERA officials over the next 6 to 9 months.
Call Maurice Bradley for supplementary.
Thank you, Deputy Speaker, and I thank the Minister for his answer. Minister, has been highlighted, as you have rightly mentioned there, in recent developments, the shortage of vets across Northern Ireland. Can I ask the Minister if his department could bring a brief outlining the progress of the DAERA committee as soon as possible? It's something that I've raised both in committee and in the House, and I would be keen to see progress.
The department will be happy to update the DAERA committee and indeed the member as we go along here. Obviously, we have commissioned this work from the Strategic Investment Board. I would like to see that work completed as quickly as possible and identify a way forward on it. Clearly, we have a shortage of veterinarians, and as a consequence of that, veterinarians come from other countries to Northern Ireland to help sustain our agri-food sector. Our agri-food sector is worth some £5 billion to our economy, and therefore it is critically important that we achieve that. But it will be much better circumstance to be able to ensure that we have the appropriate veterinarians educated here in Northern Ireland, and we will have less leaking of those young people who take up that course and do it in mainland Great Britain, in Europe, and indeed in the Irish Republic.
I call Philip McGuigan.
Very Margaret, last Collier, and the Minister in his answer alluded to the fact that we have a shortage of vets here in the north. Over and above that, perhaps the Minister could outline for us the benefit of a veterinary school here for animal health and welfare and on the agri-food sector.
Well, we have an excellent research facility here in Northern Ireland through AFBI and indeed other sources, and we have some large pharmaceuticals in the agri-food sector as well. So we are a country which is moving forward on all of these things. So therefore, the tie-up between a university which is specialising in veterinarian course with both agri-food and with the pharmaceutical sector for agri-food would be hugely beneficial in terms of research, in terms of encouraging young people to take up the veterinary course, having it available locally,
would be hugely beneficial. It is an expensive course, and therefore universities have to take all of those things into account in bringing it forward. But nonetheless, I think it would be hugely beneficial for Northern Ireland, as well as the universities, whatever university or collaboration of them, take the opportunity up.
I call Steve Aiken.
And may I thank the Minister for his answers so far. As the Northern Ireland Protocol, and particularly the TCA, where it comes to the recognition of qualifications, has that increased any pressure on the availability of veterinary services and vets here in Northern Ireland?
Well, the protocol certainly placed pressure, because we are requiring, if things do not change, around 600 officials at ports between DAERA and the local councils. And we'd be looking close to 200 vets. And they just do not exist. You don't train vets in 6 months, you train vets over 5 years. So the vets don't exist for that job. And the problem is that if we draw vets off other services, are we damaging animal welfare? Are we taking vets away from veterinary practices who are out on farms or who are engaged in small practice and all of that? So, you know, we're left in this ridiculous position where vets will be checking food, which came here for years without checks and is going to be consumed in Northern Ireland, and they're not available to actually do things which are required for animal welfare. So it does certainly have a very significant impact.
Moving on, I now call Cathal Boylan.
The last one, Kester Roche, question number 6, please.
There's been significant stakeholder engagement and consultation in developing the draft rural policy framework to date. In light of the COVID-19 pandemic and the impact that it has had across rural areas, we have been reviewing the draft of the rural policy framework document to ensure that it is reflective of the ever-changing context before going to public consultation. It's always been the intention that the rural policy framework will be a living document that is intended to be flexible and adaptable to change. So, subject to securing the necessary approvals, I hope to launch a public consultation later this spring. It's anticipated that the rural policy framework proposals will be available for an 8-week online consultation period. Officials continue to deliver a range of schemes to support rural communities, and the businesses with just over £20 million invested in rural development programmes in the financial year just finished.
I call Cathal Boylan for a supplementary.
I'd to thank the Minister for his answer. The Minister will be aware that the Community Renewal Fund, launched by the British Government as a main plank to the Shared Prosperity Fund, can the Minister provide any information on that scheme on whether or not there will be a consultation in relation to trying to protect and give rural communities opportunities to access that scheme?
I would certainly hope that there will be the opportunity for consultation on the Shared Prosperity Scheme. Obviously, that is a scheme which has been delivered directly from the Westminster Government. Unlike others, I don't complain about it, because it's additional money for Northern Ireland ultimately. It's additional money for the people that we represent in this House. And just because it's not us distributing it is not something that I'll decry. I didn't decry the EU money whenever it was coming. And this money, which will be very much replacing some of the structural funds, etc., that came from the European Union, is something that I would welcome and will seek to influence as best I can for the benefit of my constituents.
And that is the end of our period of time for listed questions, and we now move on for 15 minutes of topical questions, and I call Gemma Dolan.
Can the Minister confirm if he consulted any environmental experts other than the Climate Change Committee when developing his proposals for a climate change bill?
Well, the Climate Change Committee is the expert independent panel set up by the UK Government, and they have appointed independent experts to give that advice. So our department works very closely with all of the bodies that are involved, all of the NGOs that are involved in environmental issues. We support them with significant financial support, and we listen to what they have to say and engage with them on the issues. So I would suggest that the evidence that the Department has taken is much greater than the evidence of those behind the Private Members Bill. And I would wish those members who are supportive of it to indicate to me and to the general public in Northern Ireland what independent evidence they want to bring to the table, because saying that Scotland's doing it by 2045 is not evidence. That is an indication of what another country can achieve. And by the way, the Climate Change Committee are supportive of that and are recommending that, whilst they're recommending something different from Northern Ireland. So I'd be very interested in evidence, and I await the members' evidence coming forward.
I call Gemma Dolan for a supplementary.
I thank the Minister for his answer. The Minister's proposals don't actually commit us to net zero by 2050. There's a wealth of expert advice that says the North is capable of reaching true net zero by 2050 without unfairly affecting specific sectors, such as agriculture. Given the severity of the climate crisis, does the Minister think it's appropriate that we do the legally required minimum when more ambitious alternatives exist?
I don't believe it is appropriate that we do the minimum. I believe it's appropriate that we do the maximum. And if the member has evidence, and I know she says there's a wealth of it, so I look forward to hearing the evidence as opposed to pontificating that it exists but not actually producing it.
And I call Rosemary Barton.
Thank you, Minister. Minister, while I understand there's a mitigation in place at the present time regarding the vaccination of pets up to the 30th of June, Great Britain, as you know, is now opening up again to receiving visitors, tourists, etc. And of course, holiday time is coming. Can you advise if this mitigation will be extended into July and August for people from Northern Ireland wishing to go there on holiday and then returning with their pets from GB into Northern Ireland? Thank you.
Thank the member for the question, and I do welcome the fact that the mitigation was introduced in January and give us that 6 months. I wasn't looking for that 6 months to allow us time to prepare, although some people will. I was looking at 6 months to negotiate away this nonsense where pets have to be treated for conditions that don't exist in either the United Kingdom or the Republic of Ireland. So the British Isles is free of these diseases, and therefore we are imposing upon pets, upon animals, something which is unrequired, a medicinal practice which they don't need, and I think that we have to resist it as firmly and as strongly as possible, and that's what I'm engaged in doing.
Call Rosemary Barton for supplementary.
Thank you, Minister. And just when we're talking about the issues in relation to the protocol, etc., can you also give me an update on the regulations that are in place at the moment for importing pedigree cattle into Northern Ireland? Is there any movement there?
Thank the member for that question. And again, we have a significant problem with the importation of both cattle and sheep. And as a consequence of that, there is a large number of black-faced sheep in particular, not exclusively, but black-faced sheep in particular, which are currently in Scotland. They've been bought in September, and the farmers cannot get them home. And the EU have been very rigid about this thus far, in spite of our requests. And I think that we need to get some flexibility. There's farmers in the Antrim Hills and the Sperrins and in the Mournes and so forth who have invested heavily and are not getting those animals brought home. As well as that, the pedigree industry has been badly affected because they previously were taking bulls and heifers to Scotland and indeed to the north of England for some of the large sales there. Because of the 6-month standstill, they're not prepared to take that risk because if they don't sell the animals, then how are they going to ensure those animals' welfare on another farm in Scotland or England? In terms of how those animals have been treated, because they're high-value animals. And this is devastating for the pedigree industry in Northern Ireland if this issue is not resolved. And it is a ludicrous issue in terms of securing the single market. It has no impact whatsoever on the single market. And the European Union really need to back down on this and wise up and treat Northern Ireland with a degree of respect.
And I call Gary Middleton.
Thank you, Mr Deputy Speaker. The Minister will be aware that climate change is an issue which concerns us all. Can the Minister outline what independent scientific advice he has received within the Department in terms of formulating the proposed climate change bill?
Well, as I indicated to Ms Dolan, we have been taking advice off the Climate Change Committee, which is a panel of experts, and they're independent experts. And I recently received a letter from the chair of that committee, and it indicated that our analysis has not produced a scenario for UK net zero in 2050 that sees Northern Ireland reach net zero in the same year. We are not therefore able precisely to calculate the costs of Northern Ireland reaching net zero, but they will almost certainly be higher than those of the 82% reduction target by up to £900 million a year by 2050. If engineered removals technologies are used, the context of a net zero target, 2050 target for the whole of the UK, is also important, and that is what we need to focus on as one country moving forward with a net zero target, and that is wholly achievable, and Northern Ireland can play a very significant contribution in that.
I call Gary Middleton.
Thank you, Mr Deputy Speaker, and can I thank the Minister for that response. The Minister has set out that his bill would set targets to reduce greenhouse gas emissions by 82% by 2050. Others have suggested net zero by 2045. What impact would this have on Northern Ireland, and is it a realistic target?
Well, I believe the member to my right, Mr Aiken, actually thinks we can do it by 2035. However, I'm not sure where his expertise comes from. But the climate change experts are saying a larger reduction in output from the Northern Ireland livestock sector would be required, and compared to the rest of the UK. And even our most stretching tailwind scenario, which entails a 50% fall in meat and dairy production in Northern Ireland by 2050, and significantly greater levels of tree planting on the land released, is not enough to get Northern Ireland to net zero emissions in 2050. Without a corresponding reduction in the consumption of such produce, this would simply shift emissions overseas. So I want to listen to climate change experts, and I suspect that there's a lot of climate change experts in this chamber who I'd be slightly less inclined to listen to. I prefer to listen to the Climate Change Committee, who have some expertise and background in these matters, and I think we do well not to destroy the Northern Ireland economy, not to be putting 50,000 people, because there's 100,000 people involved in agri-food, not to be putting 50,000 families into the unemployment region because we want to grab a headline.
I call Kiva Archibald.
Last Corlia, and I suppose following on from the previous question, can I ask the Minister what work his department is doing in terms of scientific work to recognise the importance of carbon sequestration in our soils, hedgerows, trees, etc.?
Well, that is a course of work that I want to engage very closely with this Assembly on. We have significant opportunities in our peatlands for carbon storage, but that will involve wetting those peatlands, and as a consequence of wetting those peatlands, the farms that are closest to it will probably lose, and most likely lose, ability to graze those lands, certainly for as long a period as currently the case. And therefore, those farms need to be adequately compensated, and therefore the opportunities to tap into a new single farm payment scheme, which we're not restricted to by the European Union, gives us that opportunity to do that. I also want to look at the opportunities of having more structured management of our hedgerows, because the hedgerows are superb capturers of carbon, and whether we bring that into the single farm payment scheme, that farms have a structured plan for their hedgerows that will enable them to and encourage them to actually grow those hedgerows for longer periods of time. One of the biggest assets we have is our hedgerows, and if we could grow them a metre higher or a metre wider, they will capture massive amounts of carbon. So we can work through a lot of this together without inflicting the massive pain that I referred to the previous member, and I think that is what must be done here. We must identify the means that we can of ensuring that our carbon footprint is reduced, but not destroy our farms in the process by doing illogical things.
I call Kiva Archibald for supplement.
Concordia, and I thank the Minister for that response, and I'm sure the Minister would agree that we need to be ambitious in terms of what we're doing to reduce our carbon footprint, and that the role of carbon sequestration and an understanding of that is really important to the public discourse around all of this, in terms of recognising the service that farmers also do to support the environment, and in terms of also ensuring that there is adequate knowledge transfer
Could the member come to a question?
And encourage farmers to do these types of schemes on their land, and, as you referred to yourself, rewarding them appropriately.
And I think that farmers recognise that they have a contribution to make, and they're engaging very positively in making that contribution, and it is for this Assembly to engage positively with them, and therefore, I think that the Assembly would be much wiser to follow the path that I'm recommending in terms of the climate change legislation, because that will work with the farming community. And let me say this, at least 82% is at least. It could be significantly more than that, if that is achievable. And as the science develops, and as we identify, for example, what carbon capture actually exists in our grasslands, and how that can be greater even in hill areas, because more of that grassland gets tramped, and therefore the grass goes back into the soil, and that grass has captured carbon from the atmosphere in the first place. Then we can perhaps move forward with something more significant. But we need to give ourselves a degree of latitude, as opposed to enforcing some fixed thing, which doesn't give us that latitude and inevitably causes massive harm to our farm families, takes away their livelihoods, takes away the jobs in the industries that are associated with it. That's a hugely unacceptable position for me as the DAERA Minister and as this Assembly's spokesperson for that sector.
I call Thomas Buchanan.
Mr Deputy Speaker, can I ask the Minister if he could give us an update on the future food strategy framework?
Yes, we have done considerable work on that, and we are at the point of making an appointment to take that forward along with the DFE Minister, and that is something which is being progressed and will be announced next week, given the sad death of the Duke of Edinburgh. We don't propose to announce this week.
I call Tom Buchanan for supplement.
Yeah, can I thank the Minister for his response, and perhaps the Minister can give us some indication as to what thought or role perhaps the government departments can play in supporting Northern Ireland food producers?
Well, we want to see, and our department is very clear, it wants to see Northern Ireland at its best, and many of our farmers are at their best and achieving really great things, are world leaders. Some others are somewhat behind, so good quality benchmarking, identifying what is achievable, encouraging people to be progressive in their agricultural practice. All of those things are very, very important. How we can actually use the whole climate change agenda to actually develop new interests on our farms. So can we take the excess of farm nutrients and develop those into something which is sellable to other parts of the world which actually lack those nutrients? So we have a surplus, they have a deficit. Can we invest in capturing those materials in a way which enables us to actually sell that as a product and have a win-win for both the environment and indeed for the agri-food sector?
And that is the end of our period of time for questions to the Minister. I would ask members to take their ease for a few minutes until our next period of questions to the Minister for Communities.
Thank you, members. We now are moving on to questions to the Minister for Communities. Can I advise the House that question number 12 has been withdrawn? I call Mr Paul Frew.
Mr Principal Deputy Speaker, question number 1, Minister.
Thank you. I suppose just an outcome on the report on the consultation was published on the departmental website in November 2020. There was overwhelming support for the reform of the gambling legislation, and I'm in record as saying that the legislation reform is long overdue, given the scale of the reform that's needed. I am keen to bring forward proposals for some regulatory change in this mandate, and have advised for the Committee for Communities of my intention to do so in the schedule of legislation. As soon as I am in a position to do so, I will make an announcement on the way forward as quickly as possible.
Mr Frew.
Thank you, Minister, for your answer and your commitment to bring in legislation in this term. It's really appreciated. Article 168 of the Betting, Gaming, Lotteries and Amusements Northern Ireland Order 1985 prohibits promotional non-skill prize draws linked to a product here. Would any legislation take into consideration the fact that UK-wide companies that undertake promotional prize competitions that are linked to the purchase of a product disadvantages Northern Ireland consumers by the fact that they are not involved?
Yes, well, those issues were picked up on in terms of the consultation and engagement that has been ongoing, and part of that will be coming forward in changes in the time ahead.
Mr Robbie Butler.
Thank you, Mr Deputy Speaker. I welcome the Minister's point here. Just would like to give the Minister an opportunity to join with me and welcome wish our football team the very best of luck tonight as they face Ukraine and try and defend a 2-0 lead and hopefully do even better. But would the Minister's proposals perhaps to ban gambling practices that are most likely to cause harm be something that she's considering? Such things like free bets, free spins, VIP schemes and reverse withdrawal functions?
Yes, well, all of those options are being looked at and obviously were actively considered in terms of the impact that it has. I'm also obviously working in terms of health to look at the health implications and issues around addiction in terms of gambling services as well. So that is being considered, and I think there was a recognition when the consultation went out that reform is definitely needed in these areas. And of course I wish the team well tonight and hopefully they'll come home with a victory.
Ms Karen Mullen.
Minister, will you support the establishment of an independent gambling regulator?
Yes, I would indeed support the establishment.
Mr Mark Durkan.
Thank you, Mr Principal Deputy Speaker. I thank the Minister for her answers thus far. Could the Minister outline what steps or actions, if any, government here or even government elsewhere could take to ensure tighter regulation of online betting sites?
I think it's an issue that's being looked at. Obviously, it's a growing issue just by its very nature in terms of social media and in terms of online gambling opportunities that are presented to people. So, of course, we're proactively looking at ways that we can engage. Obviously, we're discussing this in terms of health as well and the impact that it has at the other end. And obviously, any legislation that we want to bring forward, we want to look at prevention before it gets to that critical point then where people need assistance and need in terms of the addiction that they have. So we're in regular engagement in terms of looking at those options, and we'll lay those out in the time ahead that will take into consideration, I suppose, the increase in issue of online gambling.
Mr Jonathan Buckley.
Question number 2.
Thank you for your question. And just as I have outlined in previous statements by my department, we have no plans in place to mark the centenary. A £3 million fund, however, to mark the centenary has been set up by the British Government, and this includes £1 million of funding to be distributed through the National Lottery Heritage Fund, with the NIO as in the lead. That aside, in line with the statutory remit of PRONI, they will facilitate access to archival records it cares for, which are relevant to the centenary, by individuals, organisations and the media. PRONI will also launch an A-level educational resource entitled 1900 to 1925, Crisis, War and Revolution in May 2021, which comprises a range of archival material covering the period, including sources relating to the establishment of Northern Ireland State and opening the Northern Ireland Parliament. Plans have been in place for some time now across a number of our arm's-length bodies and other funded organisations to mark the centenary, and I have asked my officials to write to you separately, just providing you with an update of their plans.
Mr. Buckley.
Well, Deputy Speaker, sadly the Minister's answer today confirms verbally what indeed the Minister confirmed to Mr Allister in written format, that in a sense the Department of Communities will not fund the centenary celebrations in Northern Ireland. Many people in Northern Ireland will rightly view your callous snub of the centenary as a recurrent and running theme within Sinn Féin for Centenary Stone, and now a department which has so much responsibility, no funding coming forward. So can I ask the Minister, when will the Department of Communities, plural, step up and respect the cultural aspirations of a significant community within Northern Ireland?
Well, firstly, there's nothing callous in my approach, and I have to say that right now to the member, and I think it's unfortunate that he's trying to use those remarks in terms of this question. The reality is that I think anything around the marking of the centenary, when you look at the decade of centenaries, and I was involved extensively in this in Belfast City Council as my time as a councillor, where we did manage there to agree a programme that looked at all of these events in the context of one event has an impact on another. So whether that was the formation of the Northern State or whether you looked at that in terms of partition and looking at that from the different perspectives. And I think as we approach all of these issues, and they are sensitive issues, for some it's a celebration and for others it's not, it's an event which has negative connotations. And I think that we need to be responsible and sensitive in terms of how we address all of these issues. What I would prefer to see is that we sit down collectively as an executive. It's not just the responsibility for me as Communities Minister. We need to approach these sensibly. We need to look at all of the events in their widest context and how one event has an impact on another, and how then we can communicate that with the public, because we are living in a contested society. We are seeing issues emerge on our interfaces and things rupture. And I think that anything that we do has to be planned, it has to be considered in terms of looking at all of those issues. My experience of how that worked well before, as I said, was within Belfast City Council, where all of the political parties, or most who are represented in this chamber, sat down in a coordinated and structured way to plan out events. Now that hasn't happened. The NIO, of course, are running forward with events. Some of my arm's-length bodies in those departments, such as Plenary, as I said, are doing events. But if we're serious in terms of looking back at the past, learning on that, in terms of building forward for the young people that we've seen on the streets of Belfast and beyond over the last week, then we need to be mature about it rather than saying that we're acting callously. We need to look at all of these issues in the round in terms of how it reflects right across the community. And of course the centenary is held dearly by some people in our society, but so too is the issue of partition and the ramifications, and we need to look at all of that in the round.
There are several other members listed. I would ask members to be direct in their questions and the Minister to be direct in her answers, otherwise this maybe will take up the entirety of question time. Mr Pat Sheehan.
I've got a free last Concorda, and following on from the Minister's previous answer, would she agree that there are many people here in the North who find nothing at all to celebrate about partition and what followed on from it, and that it's important that any centenary events reflect the different narratives of the past here?
I think we have a layered and complex history, and we do have a responsibility to lead. We obviously are coming from a contested and divided society. We're trying to build reconciliation, we're trying to give hope to the future for our young people, and we need to approach all of these historic events, which can cause, I suppose, issues to rupture again. We need to do that sensitively, we need to do it collectively, and we need to look at the issues and how they knit into one another and how they have an impact on communities as a whole. I'm willing to engage in a process like that, and I would ask that others do the same.
Mr Jim Allister.
The title that the Minister holds in this House is Minister for Communities. She knows that the unionist community, for it, the centenary of Northern Ireland is very, very important. And yet, consciously and deliberately, she presides over a department in which she did not seek one penny for its budget, does not have money to spend for the community groups within that unionist community who want to celebrate the centenary, or to organisations that want to celebrate it.
Order.
When is the Minister...
I appreciate the depth of feeling that there is around these issues, and Mr Buckley had tabled his question, and I give him some leeway. The entirety of question time will be taken up by this issue if we have long preambles into questions. I appreciate this is very sensitive and a very important issue, but it is important that questions are short, sharp and focused, and that answers are short, sharp and focused. Mr Allister.
When is the Minister going to start on this issue, being the Minister for all communities, and not just the Minister for the Sinn Féin community, despite her pious words?
Well, I think firstly we're in a decade of centenaries, and I haven't brought forward proposals for any of those issues. I know the NIO, obviously through the auspices of the British Government, has given a commitment in terms of marking the centenary of the formation of this state. As I say, I would have preferred a programme that looked at all of the centenary holistically. My focus in terms of being Minister for Communities is delivering vital services right across the community, be that in the areas such as Sandy Row, Donegal Pass, the market in which I live, Springfield Road or Shankill. It's issues around housing, it's issues around inequality, it's issues around income that people have, and that's certainly where my focus has been over this last year, and particularly addressing issues relating to the pandemic. And that has been right across the community, because I see it as one community that may have different traditions, but my focus has been on delivering for all of those communities. And I think many in this chamber and outside would accept that I have done that in a respectful manner.
Dr Steve Aiken.
I thank the Minister very much indeed for her comments so far. And indeed, may I welcome the remarks made by the Deputy First Minister in regard to HRH Prince Philip, which is very much respected by our community and indeed by across of Northern Ireland. But in view of that and the spirit of reconciliation, could she and her party not see the way forward to agreeing to having just even a centenary stone here on the grounds of Storming? Because I think that would say just as much.
I think in terms of all of these issues, I've said it before, and you'll know yourself being a party leader, we all have a responsibility to look at the community as a whole. We are coming from a divided society, and we know that anything around symbols can cause tension. And I think the best way, the mature way, is to sit down collectively with all of the parties. I know my party is willing to do that. I know I'm willing to do that in terms of being a minister. We need to sit down collectively on how we can address these issues, so everyone feels that their issues and what's important to them are addressed in a collective manner. As I said, I have given a good example of how that was done in Belfast City Council, looking at the issue of Home Rule, looking at the issue of the Covenant, looking at the 1916 Rising, then starting to look at this most recent period in terms of the centenaries that we're approaching. That was done in a collective way with principles in terms of looking at all of the issues, and I think that that is the best way forward. It has been practiced in Belfast. The sky didn't fall in. Every party around that table, as I say, that's represented in this chamber has welcomed the approach that was taken. And I would say that if people are serious in terms of looking at the whole community, looking at the aspirations then of individual identities and needs, then sit down collectively around the table, sit down and work. I'm willing to do that, to look at all of these events, because the centenary is important for a good section of the community here, but so too is looking at the issue of partition and the ramifications that that had. And again, I accept people will have different perspectives around that, but let's sit down and see how we can mark all of these events collectively, rather than trying to rip each other down, because what example is that sending out to the young people that were on the streets of Belfast and beyond over the last few weeks? We need to be seen to be providing leadership on these issues, and I would welcome that leadership has to come across this chamber and with all the executive parties, and I'll play my part in that.
Claire Sugden.
Thank you, Principal Deputy Speaker, and thank you, Minister. I appreciate that the Minister and others do not wish to recognise the centenary, but is this not a lost opportunity to look forward for all in Northern Ireland by perhaps investing in youth and in doing so in the name of NI 100? For me, the centenary is about looking forward, and I think there's a real opportunity to do that. For all the issues that the Minister herself has raised, I think we have to look at how we unite Northern Ireland moving forward, and there is an opportunity through NI 100.
Well, firstly, I do recognise the centenary. I recognise that it's an historic event that happened, that it still has an impact on our society here today, what way you look at that society and what your hopes are forward. My view is that also partition happened, and it was a reality as well that also had an impact. And we need to look at all of these issues in the round in terms of how we address and organise programmes that can be bought into right across our communities and across society, and to do that in a coordinated and structured way. Because if it doesn't, then it becomes a free-for-all, it becomes then a fight and an argument, and I don't think that's good for the young people out there or for society as a whole. I have seen in good practice how this has worked, and I just think that we need to be looking at examples like that have said and build on those in the time ahead. But that involves all parties around this assembly. Are they willing to buy into that? Are they willing to sign up to principles that looks at all of these events, that looks at it from the varying perspectives that are out there? I mean, I attended Covenant events. I attended dinners to mark the Battle of the Somme and others. Some people chose not to do that at that time, and that's the type of responsible conversation and leadership that we need to have. I'm willing to engage in that, and the question is everybody else?
Mr. John O'Dowd.
Question 3.
Thank you. I've set out an ambitious and long-term plan to increase the supply of social and affordable housing and reduce housing stress. However, these plans will take time to come to fruition. And whilst I share your concerns that there are a number of applicants for social housing and those in housing stress continues to grow, the projected outcome of my plan is about ensuring the supply of social homes and ensuring that it can meet the increase in demand. Crucial to this is the protection of social homes we have, ensuring that they can be maintained and ultimately through the Housing Executive in a revitalised form, being able to access borrowing to sustain itself and to build again. It is the new build programme that in the shorter term is the key action that we can take, and one of my priorities is to enhance the investment and the increase in new social home starts. Once the budget for 2021-22 of the Housing Development Programme has been finalised, I will announce further details on the new social homes that will be started very soon. I am aware that the Housing Executive, that the current projected housing need for North Lurgan is for a further 168 new social homes between now and 2025, and the Executive are committed to working with the housing association sector to bring forward new social home proposals to address that need. I understand the Housing Executive and social housing associations have been forwarding a high volume of proposals for the North Lurgan area over the past 12 months, and I'm pleased to advise that new housing schemes providing 39 units are due to be complete in the area later this year.
Mr. O'Dowd.
Thank the Minister for her answer. I welcome the Minister's plans for social and affordable housing moving forward. And I thank the Minister for agreeing to meet me on housing issues in North Lurgan and rural areas within my constituency, because the waiting list continues to grow. Will the Minister undertake to keep the pressure up on the Housing Executive and social housing providers to ensure that housing is provided in areas of most need?
I think, yes, definitely. As part of the housing statement that was given last year, there are a number of strands of work in terms of looking at housing supply, in terms of looking at the social housing development programme, looking at issues of ring fencing in those areas of greatest need as well. So there are a number of areas that I will be bringing forward proposals in the short term, but indeed I've also given a commitment in terms of the overall revitalisation of our housing sector and ensuring that we are meeting those critical demands going forward, that I will present those plans to the Executive that will be costed and timetabled before the end of this Assembly mandate.
Call the Deputy Chair of the Communities Committee, Ms Kelly Armstrong.
Thank you very much, Principal Deputy Speaker. Minister, thank you very much, and I absolutely support your commitment to social housing. But can I ask if you could assure this House that you are committed to shared housing? We've recently seen disgraceful actions happening in Carrickfergus. Can you assure this House that you will dedicate to providing shared housing where people from all cultures and backgrounds are able to live together, and that we stop enabling housing zones that exclude based on religion, culture or race?
Yeah, I think recent reports in recent days are really unfortunate and obviously need to be condemned, and I know they have in terms of the community, because housing is a fundamental right. It's the basic thing that somebody needs and for society to function in terms of people having a home, and particularly those in most critical need. So I am committed as part of the housing transformation. It is about building suitable, affordable and sustainable housing for those who need it, and to build it where they need it as well. And of course that will include a composition of shared housing going forward as well. I mean, obviously we are doing a number of programmes, and we will be looking at that as part of the housing mix going forward. I'm more than happy to discuss it with the member as a follow-up.
Mr Pat Catney.
Thank you, Mr Principal Deputy Speaker. Thank you, Minister. Minister, can you give an update on the abolition of the rights to buy, a house sale scheme in the Housing Association, since the passage of legislation last year, when action she is taking to extend that to the NIHE properties? Thank you.
Ongoing at the moment around bringing forward a consultation on the future of the Housing Executive House sale schemes, and this will be brought forward in the coming weeks.
Mr Robin Newton.
Thank you, Mr Principal Deputy Speaker, and I thank the Minister for her answers so far. Minister, would you respond to the report of yesterday in the Belfast Telegraph, which indicates that, and as the current situation stands, that in 20 years' time we will not have met the housing need?
Yeah, well, it's obviously the report is reflective of statements that have been made in this chamber, both by my predecessor, Carl, whilst I was off, and then subsequently me coming back. That's part of the critical reason that a statement was brought forward in November in terms of revitalisation of the Housing Executive, because one of the biggest issues is obviously to deal with the historic debt. I know we have gladly already dealt with the issue of corporation tax exemption, and that has obviously been really good. But we need to be getting the Housing Executive to build again. There are issues there in terms of supply, and we're bringing forward a housing supply strategy to look at these issues as well. We're also looking at the issue of homelessness and revising that as well, and there's been some good learning as a result of COVID in terms of how we proactively work better with health, in terms of looking at issues of prevention, and also actually sustaining tenancies for people that they don't repetitively become homeless again. So all of those issues are part of the revitalisation agenda. Obviously we're bringing forward some in terms of the house sale scheme, because I recognise that on average we're building 1,800 homes a year. Nearly 500 of those are being sold off then in terms of the house sale scheme. So we need to fundamentally deal with that in terms of not depleting the social housing stock that we have there. And that's one of the areas that I'm looking at in the time ahead. Whilst being more ambitious with the housing development programme, 1,800 homes a year is not enough, and we need to have better ways of developing. Land is an issue, and obviously we're looking at the land and supply strategy as well.
Minister,
we're trying to work with local councils around that, but happy to share more info in terms of that programme.
Ms Rachel Woods.
Deputy Speaker, and I thank the Minister for answers so far. And the Minister touched upon corporation tax in her answer to Mr Newton. On the 3rd of March, the Minister stated that the Housing Executive has paid almost $58 million in corporation tax, money that could have been invested in homes for the benefits of tenants. Can I ask then how changes made to corporation tax structures and financial savings stemming from it will be measured, and will savings be reallocated to address housing waiting lists, quality and added benefits for people?
Yeah, well, part of the plan is we want that to go into maintaining the existing stock. There's obviously huge challenges, and again, that's part of the revitalisation agenda, that if we don't make changes now urgently, I mean, we've been talking about this for over a decade now, and change needs to happen now or we're going to lose half of the stock that the Housing Executive has. That's the hard reality, and that's part of the cost analysis that we're doing. So it is really good and significant, obviously, that the issue of corporation tax is now being resolved. And obviously we want that to go directly back in then in terms of that function around maintaining the properties that are there, and then looking at new models going forward that the Housing Executive then can borrow in terms of having a more ambitious house building programme as well.
Mr Declan McAleer.
Question number 4.
So I'm pleased to say that 887 grant awards have been made for a total of £16 million. I know how important the charity sector has been in helping us through the crisis. My wish would have been for charities to claim all of the £20.5 million that was available, but I'm satisfied that the money claimed has met the urgent financial need and kept charities afloat. I'm grateful to our delivery partners, the National Lottery Community Fund and Community Finance Ireland, for the swift and agile way they administered the fund, and also to Nick for the support that they've provided to the sector throughout this process. It would obviously not be possible to name all of the charities who were supported through the fund, but just to give an idea in terms of the diverse nature. So obviously we supported charities through chronic illness like Action Cancer, animal welfare and environmental charities like Kids Pony Foundation, religious groups such as Dundrow Presbyterian Church, homeless charities like Extern, community groups like Limavady Community Development Association, and many other charities that have relied on this essential funding to keep them going.
Mr McAleer.
I thank the Minister for her response and for her leadership in this issue, and indeed that investment will come as a relief to a lot of charities whose traditional means of fundraising have been curtailed as a result of the pandemic. Will the Minister agree with me that charities play a huge role in our community and our society, and they will need our ongoing support and assistance to rebuild as we move towards the recovery phase? Thank you.
Yeah, I think charities play a huge role, and we can see that particularly during the height of the pandemic. I think obviously no one charity looks the same at the other, and there's large-scale charities down to something that's very, very local. So there's a wide range of activities that take place. Part of the engagement that we have had around COVID and around this fund has obviously allowed us to kind of establish and to look in more detail at the nature of the charity sector, and obviously going forward as we look at the social recovery phase, the economic recovery phase, we want to continue to keep that engagement going to ensure that we do have a charity sector that is fit, that is able to deliver the services that they are, and to make sure that any future shocks, whether they're economic or health, that we can then mitigate and learn the lessons from this most recent pandemic.
Mr Matthew O'Toole.
Mr Principal Deputy Speaker, Minister, it would just be helpful. Could you give us an update on the total allocation to over, I think, the two tranches of funding for the Charities Fund? Welcome as it was, you said it was 16 million that was dispersed. 11.7, I think, was the second tranche that was announced in December by Minister Nicullin. It would just be helpful if you could give us an update on exactly how much was allocated and how much was actually spent out of that. Thank you.
Yeah, so Phase 1, which opened last year, there were 501 successful applications, totalling £8.8 million. Phase 2 obviously opened in January of this year. There were 386 applications successful, of which a total fund of £7.18 million was given as well. And obviously Community Finance Ireland's administration fees and that were attached in terms of the overall cost as well. So the total fund and expended was £16.3 million, and that includes the administration costs.
Mr Andy Allen.
Speaker, and can I at the outset declare an interest as a charity trustee? The Minister and members across this House will be no doubt aware of the important and vital work carried out by charities right across Northern Ireland and further. Minister, can you advise what work the Department is currently undertaking to better understand the impact of COVID-19 on the charities moving forward, and what tailored programmes will be coming in the future to continue to support and sustain those charities?
Well, obviously, firstly, the impact of COVID. I know we're starting to come out of restrictions and ease out of those, and hopefully there will be more announcements on Thursday. And we'll be keeping a watch and brief in terms of the immediate issues that charities are facing. So obviously this funding was up until the end of the financial year, so we'll continue to keep that abreast and to look at that, just like other funds that have been administered. There's obviously been good learning, as I say. I mean, the pandemic has allowed the department to re-engage with charities in a way that maybe hasn't been done in a while, in terms of looking at the needs, in terms of looking at the impact of the charities, in terms of the learning of the pandemic as well, in terms of what it has exposed within our society and the vulnerabilities of certain sections and groups. And I think as well in terms of the capacity and vulnerability of even the organisations themselves, that if there is a shock out there in society, how that impacts on their organisation. So there has been a lot of learning. Officials within the department are writing that up at the moment, and obviously we want to move forward to see what way we can support the charities, looking at the relationship that we've established with the lotteries, with Community Finance Ireland and also with NICFA, who have done some really excellent work in supporting those charities as well, particularly around building resilience of volunteers that are involved, looking at mental health programmes that have been run as well through the Warm, Well and Connected programme. So we want to build on all of that in the time ahead and obviously have a co-design approach to any future provision that we make.
That concludes the time for table questions. Before we move on to topical questions, members, could I say I think it's a shame that we only managed to get to question number 4 on the order paper. I think it does a disservice to the other members who have tabled questions, and it does a disservice to the public looking in that we were only able to discuss 4 issues in table questions today. So if I could appeal, and Lord above knows, there's nobody more windy than me at times, but if I could appeal to members to please in future try to focus the questions so that we can get through more issues, so that the people watching will get more answers to the issues. Fortunately for Mr Little, who was question 5, he's the first person on the topical list, so he'll get to ask his question again if he wishes to. I call Mr Chris Little.
Thank you, Principal Deputy Speaker. Can I also wish the Northern Ireland women's football team every success in the second leg of their Euro 22 play-off against Ukraine tonight for what would be a historic victory and a major tournament qualification for the Green and White Army? And can I ask the Minister for an update on the sub-regional football stadia fund?
Yeah, no, thanks very much. I suppose obviously, again, just to reiterate, the sub-regional stadia is part of the new decade, new approach. Obviously, my officials undertook a robust, up-to-date, evidence-based exercise and programme. There was a working group that was established involving local councils, IFA, Sport NI, etc., and the NIFL as well. We're coming to the conclusion of that. Officials are collating all of that information, and by the end of this month, going into the start of next, I'm hopeful to bring forward recommendations on the way forward to executive colleagues.
Mr Little.
Thank you, Principal Deputy Speaker. Thank the Minister for an update on this long overdue funding for football. And can I ask the Minister what budget will be allocated to this much needed funding for facilities for football?
It's still the same amount of funding that was set aside, £36.2 million. And obviously, if there is a need or an overarching demand for more, then that would have to go to the Executive for approval. But the budget as set out within the budget is the £36.2 million.
Mr Keith Buchanan.
And thank the Minister for answers so far. My question relates to sports clubs with obviously bars and restaurants that got sort of left behind, that weren't eligible for LRSS, CBRSS, or indeed missed out on the Sports Sustainability Fund because they're waiting clarification from LRSS. So I understand there's over 70 of those, Minister. Can you give us an update on what your plan is to support those, or they'll not be sustainable?
Well, I think when this issue arose, obviously the Sports Sustainability Fund had already opened, so I wasn't able at that point to pause that fund or to make changes or to allow any new applications in terms of when that closed for applications to be received. I know there has been some concerns, and obviously I've had some engagement. The Sports Sustainability Fund did allow that if they did operate a bar and they could show that those lost earnings have an impact in terms of their sport, they could apply under the Sports Sustainability Fund. I did hold a meeting with the Minister of Finance, obviously, to look at the issue as well, and I know officials were discussing it. The difficulty is, obviously, the fund has closed. We have administered the funding around that, and if clubs didn't apply, I can't change that in a sense. But obviously, we're considering to look at that to see if there are any new funding opportunities. Is there another round of sports funding that could be looked at? or could LRSS be amended, which I don't know if it could, because I know one of the concerns was that if it's on the rateable value, then a smaller sports organisation could be receiving more than a huge hotel, and there would be a disparity there then in terms of some of those issues. But again, we're keeping a watching brief. I mean, I haven't been inundated with requests from sport organisations raising concerns directly. I just know from some of the dialogue, I mean, there's been issues and we've raised it. The difficulty was they didn't apply for the scheme. And if they had done so, they would have received the funding. But we are keeping a watching brief, obviously, in terms of any other additional COVID monies that may be available coming through them. We will keep a watching brief to see if we need to make a further bid to the Executive via the Finance Minister in the time ahead coming into this financial year, alongside charities and other things that have been funded.
Mr Buchanan.
Thank you, and thank you, Minister, for answering so far. Minister, will you provide a commitment to me and to the House that you will open a new scheme and try and support those clubs? As one of my own area, Coke United Football Club, no doubt everybody else in their own areas will have numerous clubs that need support. Will you provide commitment you will open another scheme to support these, because these clubs will not be here?
I can give a commitment that I will engage and look at it. I mean, I can't give a commitment right now that I'm going to open a scheme without looking at an assessment, without realising if there's no funding there in terms of my budget at the moment. Any funding would have to be coming through the COVID funding, which is then considered against health and educational and other priorities as well. But certainly all of these issues are being actively looked at, particularly as we're looking at the recovery period as well and making sure that things can open. So we're keeping a constant view of all of that, but more than happy to engage with you on this issue.
Mr Mark Durkan.
Well, Deputy Speaker, thank the Minister for her answers thus far. We fully appreciate the efforts made and challenges faced by the Housing Executive to ensure everyone here has a roof over their head, particularly over this past year. However, there is a growing concern in my constituency, and your party colleagues from my constituency will bear this out, not about the number of people being placed in temporary and emergency housing in Derry from other districts, but sadly the nature of some of those people. There have been a number of offences committed, including a sexual attack on a girl last week by people who have been placed in housing in Derry from elsewhere. Can the Minister explain the policy and practice that allows this to happen?
Well, obviously the issue of looking at accommodation, I mean, we do try and map out accommodation where it's needed. I mean, primarily it's a matter for the Housing Executive in terms of the accommodation strategy that they have. I know that that's being looked at currently. Obviously, COVID has presented a really big challenge in terms of people who have been made homeless through no fault of their own over this last year. And obviously trying to keep with the public health advice, trying to get those people housed as quickly as possible in accommodation where that's available. Unfortunately, sometimes that accommodation may not be available in the area that they're looking at or in the area that they need, and therefore they have to be placed in other areas. I mean, I know there has been issues pertaining to the Derry area. I know there's been communication with my department, and obviously we have engaged proactively with the Housing Executive to overcome those issues. We are looking at a homelessness strategy at the moment because we recognise that more needs to be done, that it's not meeting the need. We're also looking at a supply strategy in terms of the accommodation that is on offer, and I will be hoping to bring forward proposals in the time ahead. So more than happy to sit with the member if you wish, or to do a meeting with those representatives in your area to look at this issue in the time ahead, and obviously to engage the Housing Executive.
Mr Durkan.
Thank the Minister for that answer. Just want to, in case anyone's in any doubt, I want to place on record that Derry is an extremely welcoming city. We've opened our arms, our hearts and our doors to people from all over the world seeking refuge and a better way of life. So I'm glad, and I've just asked the Minister to confirm that she will commit to working with the Housing Executive, the PSNI, other agencies and, extremely importantly, communities to ensure improved management and minimise risk when it comes to the rehousing of known offenders.
Yeah, just to concur, Derry is a lovely city. It is very welcoming, and any time I've been there, I've been welcomed by the community across the board. I'm more than happy to meet and to sit with the Housing Executive, with communities and others to discuss any of these issues. So if a request comes in, I'm more than happy to accept it.
Ms Martina Anderson.
Minister, can I ask you how you intend to tackle regional inequalities in relation to the allocation of arts funding that's distributed across the north?
Thanks very much for your question. And obviously, this is an issue that obviously has been raised recently, obviously by yourself and the previous member who has spoken. I know I've done a meeting, for example, with dairy artists and those in the northwest as well. And obviously, the issue of regional disparity had come up. The paper that they had presented, I mean, I would agree with most of what was in the paper that they put forward, and I know that's reflective of organisations in other parts of the north as well. I mean, obviously, we're going to be looking at a renewed culture and arts strategy going forward. For me, the issue of equality around access and participation and how public funding is spent is going to be an important consideration as part of that strategy. And again, a commitment that I gave that we will do a co-design approach with organisations and with the sector and with the community on the ground in terms of the devisement of that strategy going forward.
Mrs Anderson.
Minister, as you know, for me it's always about standing up for dairy, so there's a lot of goodwill from all you said today about our constituency, and we do thank you as the members for a very positive meeting with the arts sector, and there's fantastic community arts organisations. I know you've met Studio 2 and the Nerve Centre, for instance, and many others, not to leave anyone out. So, Minister, can I ask you, given that Derry receives less than £21 per head of population compared to Belfast in the allocation of arts funding, will you tackle this by ensuring there will be a robust and dedicated strategy to tackle this stark inequality?
I suppose, just as I said there, I mean, I recognise the brilliant work that arts organisations, both at the grassroots and also strategically, what they do in terms of building communities, in terms of the contribution that it makes to the economy, in terms of just giving an outlet and an offering for people to engage in arts activities and programmes. And I suppose as part of the review and the strategy going forward, it is my commitment that the equality issue around access and participation in terms of public funding will be one of the key important considerations of that strategy.
Now, if we could call up Mr Colm Gildernew on the screen. Mr Colm Gildernew.
And thank you, Minister, for your answers to date. Minister, can you provide us with an update on the new Riverine Community Project in Strabane and Lifford?
Yeah, well, just it was obviously announced recently, just in the last couple of weeks, obviously, that the funding of €8.9 million was granted. Obviously, my department played a role in terms of the funding towards that. And obviously, this project is a cross-border community park which links the Strabane and Lifford areas together in cultural trails and looking at the history in terms of looking at peace and reconciliation as well, and also just physically connecting the communities that live there and allowing them the opportunity then for open green space. So obviously it's an excellent project. I know I've engaged obviously through press and through a video for the amazing work. I mean, this has been over a decade in the making in terms of this project, and I gave a commitment that once the regulations allow me to do so, that I want to go down and visit the project just to see it myself as well. So I look forward to that.
Mr Gildernew for a supplementary.
Minister, and I thank the Minister for your commitment to this project and the significant investment your department is making. Would you agree with me? I went to school in Caledon, the border village, and we were effectively cut off throughout that entire time from Glaslock, just a mile or two on the other side of the border. With the result that I would know very few people actually from that community, even though we're side by side here. So would you agree with me that projects like this are crucial because the border has artificially stunted the potential of those communities which straddle it?
Yeah, I think 100%. I mean, we know how many people cross the border every day, and for them it's seamless in terms of living on one side, working on the other, or vice versa, or obviously going for medical treatment or for education. And obviously the more that we can build connections between communities, both physically and also through programmes, to promote cohesive communities, to promote reconciliation and peace building, but also vitally to deliver services, essential services that people need, be that education, health or other, then I think that that's a good thing. And whether that's in the border constituencies or whether that's in our city communities that feel disconnected from cities or town centres, restitching and reconnecting those communities back in together is a critical area, and it's something in terms of regeneration and indeed through the peace programme that I want to look at more.
Ms Rachel Woods.
Deputy Speaker, the Minister will be aware of the impact of any budget cuts for the independent advice sector would have on people who are vulnerable, in poverty or who have mental health issues. So can I ask the Minister if any impact assessment has been conducted by our department on the number of appeals currently awaiting hearing?
Obviously, in terms of the advice sector, there are no cuts. I mean, I've already made clear that that budget will be protected in the incoming financial year. And obviously, pertaining to that budget, there was a full equality impact assessment that was carried out by my department. In terms of looking at the issues of appeal times, I mean, obviously, a part of the reason for that is the pandemic. Business had to stop essentially overnight in terms of that, and that has obviously had an adverse impact on those looking at that. We're obviously working with the department and also the appeal service to look at what we can do in terms of the impact that this has on people. I know there has been assessments done to look at the timescales, to look at the impacts. Obviously, we're trying to develop a programme that looks at that again. It's going to be working with the appeal service, because I know with the announcement just after Christmas in terms of the regulations, the appeal service suspended all appeals until the start of April. So again, and you know, that's their right to do that. I can't have a say over that. So we're engaging proactively with the appeals service, who I know want to reduce the number of appeals as soon as possible, and obviously we'll bring that forward in the time ahead. We've already started listing and given the opportunity for telephone appeals, online appeals as well, but we know still that the majority of people like face-to-face contact, and obviously with restrictions in place, you know, that limits what we can do. But obviously we are looking at a programme to try and bring down that waiting list as quickly as possible, and when it's safe to do so.
10-second supplementary, 10-second answer.
Thank the Minister for her answer. In relation to funding for tribunal representation, could the Minister outline how much funding has been allocated and ring-fenced in this year's budget?
I don't have the exact figure in front of me, but the budget will be the same as what it was in the previous financial year. Obviously, we're still agreeing and I'm signing off the final budget, but there will be no change from what there was previously.
Thank you, members. That concludes questions to the Minister for Communities. If members could take their ease for a few moments, we will then move on to questions to the Economy Minister. Thank you. Order, members. We're now moving on to questions to the Minister for the Economy, and I call Ms Rachel Woods.
Question number 1.
Thank you, Mr. Principal Deputy Speaker, and thank you to the member for her question. The finding in the University of Exeter report is solely the opinion of the authors and is based on a small number of interviews. It is correct that there is an obligation on the Department and the utility regulator to promote the natural gas industry. Natural gas is an important element of the energy mix in Northern Ireland, facilitating significant carbon reduction as businesses and households switch to gas from more polluting fossil fuels. To date, over 285,000 consumers have connected to gas, but with 2/3 of households here still using oil as their main source of heating, further gas connections can contribute greatly towards reducing carbon emissions in Northern Ireland on a continuing basis. Looking forward, my department's consultation on policy options for a new energy strategy states that our gas networks, which are more modern than those in Great Britain and are expected to be able to accommodate zero-carbon gas without requiring extensive upgrades, can have an ongoing role to play in contributing to net zero carbon energy. Consideration is being given to how both biogas and hydrogen injection to the gas grid could be facilitated, ensuring that our gas network remains valuable assets on the energy decarbonisation pathway to 2020.
I beg pardon, did I call Ms Woods for a supplementary? No, I'm terribly sorry. Ms Rachel Woods.
Thank you, Mr Deputy Speaker, and I thank the Minister for her answer. When I asked the Deputy First Minister about this report, she said the outworking of such a report has to have more executive discussion. So can I ask the Minister to confirm whether she has or intends to bring the key findings and recommendations to the executive, and after having roughly 6 months to review it, what decisions and plans she has had to make regarding the implementation of the recommendations?
Well, of course, I am entirely happy and at ease with forwarding the report to executive colleagues for their information. However, the part of the energy development strategy in our department that is most important is the consultation that has just been issued, the responses to the consultation that will be evaluated, and the new energy strategy, which of course will have the imprimatur of the executive when it is published later this year. That is the most important document that we will be delivering in terms of our energy strategy for Northern Ireland, a document that will lead us on the pathway to decarbonisation, to net zero by 2050, and also to giving us that green economic recovery that will dovetail with my economic recovery action plan.
I call the Deputy Chair of the Committee, Sinead McLaughlin.
Thank you, Mr. Principal Speaker. Minister, thank you for your answer so far. Would it not be prudent that for your department to suspend the promotion of fossil fuels at this particular moment in time, because it has been devalued in our long-term development plans. And we need to lead Northern Ireland to that green new energy and to meet the commitments of the 2015 Paris Climate Agreement. So are we not really wasting our time now promoting those fossil fuels? Should we not be moving much quicker to green new energy?
For fear of sounding repetitious from the previous round of questions, if we could have short, sharp, focused questions, we might get more answers. I call the Minister.
Thank you, Mr. Principal Deputy Speaker, whatever way it works. Can I thank the member for her question? And she has written many questions on this particular issue into the department, and I understand her concern in this matter. But we are where we are, and gas and the system is an important transition fuel as Northern Ireland transitions on its way to decarbonisation by 2050. We still have 2/3 of households in Northern Ireland that use oil and heavily polluting fossil fuels. So we need to use what we have in the meantime. However, there is excellent news in Northern Ireland's story so far in relation to renewables. Almost 50% of electricity generated in Northern Ireland comes from renewable sources, and we are continuing to make progress with that. And we have said that as a starting point for the new energy strategy, we want not less than 70% of electricity to be generated through renewable sources. Those are important targets on our way to 2050. And I look forward to working with the Vice Chair of the Committee and indeed the whole Committee on this very, very important issue where I think Northern Ireland can be a world leader.
Call the Chair of the Committee, Dr. Kiva Archibald.
And I thank the Minister for her responses so far. The Minister, you will be aware that, amongst other things, one of the statutory objectives of the utility regulator is to protect the long and short-term interests of consumers. In the context of the new energy strategy, have you given consideration to an additional duty to promote decarbonisation? Because obviously there's going to be investment required in renewable energy, and that's an absolute imperative to decarbonisation.
Thank you. And we have had some preliminary discussion with the utility regulator around a whole range of areas where his remit might be strengthened, in not just around decarbonisation, but indeed around gas and a wider range of areas. It is something that we plan to take forward, obviously in consultation with the regulator, but we do think that it is important, and I think it is important, and as a core value of our strategy going forward, we want energy that is affordable and that has the consumer at its heart.
Mr. Stuart Dixon.
Principal Deputy Speaker. Minister, you've launched a review into energy strategy for Northern Ireland, but would you agree with me that it has perhaps had a rather unauspicious start by alleged reports that certain critical lines within the report from Exeter University were removed at the request of your department?
Well, I absolutely do not accept. I'm presuming what you're talking about is the policy options consultation on the new energy strategy for Northern Ireland. And indeed, that has an enormous range of support right across the board and across many business organisations in Northern Ireland that can see the potential for that green economic recovery that we need to have here, and that we will build back better after the COVID pandemic. In terms of the Exeter report, which of course is entirely different, I would have to say that the author of the same report said that obviously all reports are fact-checked. This is normal practice and didn't in any shape or form impact on the outcome.
Mr. McNesbitt.
Principal Deputy Speaker. Minister, can the grid handle 70% of energy coming from renewables, and if not, what quantum of investment would be required to facilitate that?
Can I again thank the member for his question? He poses a very important question, and one which Sony themselves talked about in their recent paper that they have published. And of course we do need and will need to upgrade the grid and to ensure that the grid is fit for purpose. We also need to ensure that the generation and the sale and the distribution of electricity in Northern Ireland is done for the benefit of Northern Ireland consumers.
Mr. Pat Sheehan.
Good. Question 2, please.
Again, can I thank the member for his question? COVID-19 has had a devastating impact on our economy, And as Economy Minister, it is my duty to ensure that there is a plan in place to support recovery. I moved quickly to develop and publish my Economic Recovery Action Plan, which has been strongly endorsed by stakeholders and the wider business community. The member will be aware that the Finance Minister recently announced the allocation of £286 million to fully fund my Economic Recovery Action Plan. This includes £145 million for the High Street Stimulus Scheme, which will encourage spend in local towns and city centres. This is a clear demonstration of the priority placed on economic recovery by the Executive. I am, of course, aware that economic recovery will not be delivered by my department alone, and I support the Communities Minister in welcoming £27 million allocation from the Executive, which will be primarily used by her department to deliver the local version of the Kickstart scheme. Recovery is at the heart of the work being taken forward by the Executive Task Force. As part of this work, departments have been asked to consider the actions needed to drive the recovery process forward. My Economic Recovery Action Plan provides a comprehensive, fully developed contribution to this process.
Mr. Sheehan.
Thank the Minister for her answer. Although I'm not sure whether she actually answered the question or not. Nevertheless, one glaring omission in the action plan is the failure to identify and build on cross-border trade. And I wonder if I could ask the Minister, is that owing to the objections of her party to growing cross-border cooperation and trade rather than the needs and interests of businesses that she should be supporting?
Perhaps I should enlighten the member and indicate that my party has always supported trade and for companies to trade across the border when it is applicable and useful for them to do so. He will also understand that in my department I also sponsor and work very closely with Intertrade Ireland, which of course has been very busy in supporting businesses, not just in the COVID pandemic, but also in trying to unravel the myriad of rules and regulations that the protocol that his party supports has foisted upon businesses, and which every week I am now writing to Lord Frost in London to report the specific issues that businesses are reporting to me.
Mr. Matthew O'Toole.
Thank you. And just in relation to the protocol, Minister, the protocol, while certainly imperfect, offers us opportunity, as Invest NI, your own agency says, to be at the gateway of two markets. It offers us a unique competitive advantage, and while imperfect, and we didn't want it in the first place, we didn't want Brexit, it offers us some opportunity. Would you agree with me that images of riots on the streets, our cities being subject to petrol bombing and rioting, is deterring inward investors who are looking again at this society because of our unique position vis-à-vis the protocol? We've heard from specific investors who've been deterred from investing. Would she agree with me that political stability is necessary to attract investment, and the protocol is part of that? Would she call for political stability in order to generate investment? Thank you.
Well, first of all, I want to take the opportunity, and I think it is important to say yet again, as a minister in the Executive, that violence was wrong whenever and wherever it occurs. It was wrong in the past and it is wrong now, and I would call on people to desist. I actually, as someone who knows these areas very, very well, find it very disturbing to see what has happened in those areas over the last number of weeks. I, as the Minister for the Economy, and particularly because I am very keen to promote skills and jobs and training in all parts of Northern Ireland, have visited Lanark Way and Impact Training there, who do a tremendous amount of work. And I'm really happy to report to the House that the new Shankle Falls Women's Centre, which is being built in Lanark Way, will soon be finished and opening for business there as well. So I do hope that people desist from violence. It serves no purpose but to bring misery to communities. In relation to inward investment, I have spoken, of course, with InvestNI on this issue over recent days, and there is no evidence that at this minute in time that there is any off-putting in relation to inward investment. Indeed, we have been very busy with some potential investors for Northern Ireland, and I look forward to working with them to see the fruits of that coming to Northern Ireland. In relation to the protocol, and I do sort of commend the member on his persistence in this particular point, the protocol, while giving us access to the EU market, also brings with it a huge amount of problems for our access for our greatest and most important market, that market being Great Britain. I'll say it again, it's worth repeating. We buy more and sell more to Great Britain than we do in any other market throughout the world. I'll just finish with one last thought. So therefore, it is absolutely important that we deal with the issues of the protocol, and week in and week out now, I am writing to government about those issues, not just from small firms, but some of our biggest and best and most eminent firms in Northern Ireland.
The Minister's within her rights at any point to ask for an extra minute, so that's okay. Mr Gary Middleton.
Principal Deputy Speaker, I think it is in the Minister's credit that the Economic Recovery Plan has received such positive comments from right across the stakeholders and the business representative bodies. I welcome the fact that that has now been fully funded by the Executive. Does the Minister agree with me that alongside that Economic Recovery Plan, it is important that we now see a reopening of our economy and that we provide clear dates for our businesses to reopen in a safe manner?
Yes, can I thank the member for his question, which is not just topical but absolutely of paramount importance this week. The Economic Recovery Plan on its own is not of great use unless we have an open and functioning economy. And what we need now, and I am thankful, and I know members in this House are thankful, for the reduction in the transmission, for the vaccine rollout programme, but what we need now are clear dates so that we can reopen our economy, give businesses certainty and allow them to plan that reopening. That will then allow us to go forward with the actions in the Economic Recovery Plan, which are designed to help us to rebuild and recover after the damage of COVID.
Mr Andrew Muir.
Principal Deputy Speaker, the recovery is essential, but it must be a green recovery. What work is the Minister doing to ensure, as part of those recovery plans, that it is focused upon our green recovery, especially in liaison with their other executive colleagues?
Again, can I thank the member for his question? The member will know from my Economic Recovery Plan that green recovery is one of the 4 fundamental pillars of that Economic Recovery Plan. Not only will that lead us to a more sustainable environment, will it tackle climate change, but I believe that it will help us to grow jobs and prosperity in Northern Ireland. We are already doing some of those things, and there are many new and exciting developments in research and innovation projects such as Artemis, which will bring to fruition that really ambitious green recovery programme that Northern Ireland needs and seeks.
Dr Steve Aiken.
3, please.
With your permission, Mr Principal Deputy Speaker, I wish to group questions 3 and 4, and also with your permission, Mr Principal Deputy Speaker, I wish to avail of an extra minute to answer this grouping. I can confirm that payments to eligible businesses under the COVID Restrictions Business Support Scheme and Large Tourism and Hospitality Business Support Scheme will continue while restrictions remain in place. Whilst grant support has been a lifeline for many businesses, it cannot last indefinitely. The best way to support businesses is to get them operating again. I am of the view that the safe reopening of businesses should happen as soon as possible. On the 25th of February, I published my Economic Recovery Action Plan, which sets out a range of decisive actions to kick-start the economic recovery as we emerge from the COVID-19 pandemic. In addition to reprioritising funds within my existing budget, I have also secured an additional $286 million from the Executive, which will allow me to deliver my Recovery Action Plan in full. It is, however, important to recognise that recovery will not be completed in 1 year alone, and many of the actions set out within this plan will require funding beyond 2021-22. The action plan includes the High Street Stimulus Scheme, which officials are developing in order to provide a much welcome boost to the local economy. I look forward to announcing more details about the scheme in due course.
Dr. Jacob.
Okay. Thank you very much indeed, and may I thank the Minister for her comments so far. Obviously, the Northern Ireland, the tourism and hospitality sector is vitally important, and as the successful vaccination programme rolls out, there is a great opportunity for staycations in Northern Ireland and the ability across our islands to use our place as a destination where we can really push our economy to do that as well. Could the Minister outline any plans she has for the promotion of Northern Ireland, particularly in our centenary year, and particularly as a great place to visit if we are going to be sticking to staycations?
Can I thank the member for his question? And I, like you, think that Northern Ireland is a great place to live, to work and indeed to visit. I've spoken much about my Economic Recovery Action Plan in this chamber today, and of course within that we have some funding for Tourism Northern Ireland for a staycation voucher scheme for Northern Ireland, which I hope to roll out in the reasonably near future. We also will be doing promotion of Northern Ireland as a wonderful place to stay and visit in both the Republic of Ireland and with Tourism Ireland in the Great Britain market. All of our research suggests that people will be more comfortable travelling within the British Isles over the next number of months, and we want our businesses to be able to take advantage of that and to have a good summer season, which is absolutely essential. But of course, to do that, they need to open, and they need to open successfully, safely and above all soon, and they need a timeline to do that.
Mr. Alan Chambers.
Mr. Deputy Principal Speaker, and thank the Minister for her answers so far. Can I ask the Minister whether she is planning any additional bids to the Minister of Finance for financial support schemes to assist businesses in the wedding sector in their financial recovery from the impact of COVID-19? Thank you.
Can I thank the member for his question? And undoubtedly, he, like myself and many others in this chamber, have been lobbied and spoken to by a number of sectors within the economy that have been terribly impacted by the pandemic. Can I say, first of all, that the best thing that we can do for business is to allow it to reopen, restart and get on with doing what it does best. The wedding sector specifically met with officials from my department this week, and we're talking about the problems that they have encountered in that reopening. First of all, they need the ability to plan. That is absolutely hugely important, and plan the way forward. We will, of course, continue to support and sustain businesses, but reopening is key to making the economy work. I heard this morning on the radio that over 3,000 weddings, I think it was the hotel sector, were interviewed, that there's a backlog of over 3,000 weddings that will take place in Northern Ireland this summer. It's a huge industry and, of course, personally very important to many.
Mr. John O'Dowd.
Okay, just on the subjects of weddings, you all know Fran McCann. He got married yesterday to his lifelong partner, Jeanette. I think he waited to the lockdown because he didn't want to buy any of his dinner. But that's a different matter. And in terms of economic support for businesses, Minister, many businesses have found it difficult, if not impossible, to wade their way through the different schemes that are out there in your department. Is your department considering expanding or changing the criteria of those schemes to ensure that as many businesses as possible receive support?
Well, first of all, I will pass on my congratulations to Fran McCann, and I suppose it's better late than never in that sense, but we wish him well. The issue around schemes, as you understand, is complex, costly, and really what we need for businesses to do is to be able to reopen, and to reopen as soon as possible. I was talking to businesses within Banbridge, my local hometown, and they were indicating to me the sales they had lost since Christmas because of the restrictions and the need to shut down non-essential retail. No grant, no amount of money that we can give at people, no matter how valuable that is and how important that is, will replace reopening the economy. And many of those businesses, particularly retail, really need to see that date. They need to see that timeline. They need to know that they can reopen. Many of them are just getting in spring stock. I spoke to one young shop owner in Portadown who was really distressed by the fact that she didn't know how this stock was either going to be paid for or sold unless she was given some hope.
Mr. Matthew O'Toole.
You again, Principal Deputy Speaker. I agree with the Minister on the importance of our hospitality trade. Will she be engaging with the Communities Minister on the licensing bill, which is currently going through? At the minute, we have a very regressive, unreformed, old licensing system, which is driving rural pubs to shut, and that's damaging our tourism offer. But second, would she agree with me? I agree with her that we want to attract tourists from across the UK and Ireland, but would she agree with me that the thing that's guaranteed to keep those tourists away is looking at their screens and seeing a summer of protest in Northern Ireland? We need them to come here, and we need them not to be seeing that on their screens.
Again, can I thank the member for his question? And one thing that I think that we should be very clear about is that Northern Ireland is a peaceful, largely prosperous society that is very resilient, and with communities across Northern Ireland that are very resilient and have withstood an enormous amount of violence over the years that has been foisted upon them. We now need to move into that positive space where we are talking about opportunity, where we are talking about the needs of an economy that actually has reinvented itself over the last number of years into one of the most promising tech economies in Europe. Belfast, I think, was rated one of the best tech cities in the whole of the United Kingdom. And we need to make sure that that positive message of Northern Ireland goes out while dealing with the political and social problems that may lead to unrest. So I want us to have a perspective of what I believe is an absolutely brilliant place to live, work and do business.
Claire Shugden.
Principal Deputy Speaker, and thank you, Minister, for her answers. I agree with the Minister. I think businesses need to be opening as soon as possible. But in her responses, there are suggestions that others within the Executive are tentative about reopening. So given that the rate of infection is significantly going down, what reasons are being given by her Executive colleagues to continue staying closed?
Well, I wouldn't want to preempt any executive discussion or discuss the business of the Executive. But some are, and we understand this because our community here in Northern Ireland has suffered enormously through COVID. I was talking to one member today who was telling me of one family in his constituency who buried 3 members within 4 or 5 weeks of each other. Those are dreadful things for communities, families and individuals to have to face. So, of course, there is a lot of nervousness. But we have a tremendous vaccine rollout programme. I think that everyone involved should be praised for that. We have transmission rates that are now very low, and we cannot keep people locked down in their homes and in their houses in the way that they've been doing. People have made enormous sacrifices. It's now time to reopen and regrow our economy and rebuild and recover and work together to do that. And I look forward to working with others across this House in an effort to do that.
Mr. Philip McGuigan.
Agad, pre-last can call your cast ever five, cast ever coog.
Again, can I thank the member for his questions. I have not had any discussions with the Minister for Further and Higher Education, Research, Innovation and Science in relation to North-South student mobility. The most recent statistics for 2018-19 confirm that the total number of Northern Ireland domiciled students enrolled in higher education courses in the Republic of Ireland was 1,500. The total number of Republic of Ireland domiciled students enrolled at Northern Ireland higher education institutions was 2,245. The total number of Republic of Ireland domiciled students enrolled at higher education institutions in Great Britain was 7,375, and the total number of Northern Ireland domiciled students enrolled on higher education courses in Great Britain, including undergraduate and postgraduate, was 17,425.
I'm afraid that ends the period for listed questions. We now have to move on to topical questions, and before I call the first member on the list for topical questions, can I congratulate him on his recent nuptials, and if we could bring onto the screen the member from West Belfast, Mr. Fra McCann.
And thank you to yourself and the Assembly for the well wishes that I received. Minister, you will be aware that taxi drivers and coach drivers are extremely important to our economy, and particularly our tourism offering. However, workers in these sectors feel they are being constantly neglected by both your department and the Department for Infrastructure. If that is not the case, can you explain why only 1 out of 49 applications to Part B of the Coronavirus Restrictions Business Support Scheme was successful?
Again, I want to pass on my best wishes and wish you and your wife well for the future.
Just 39 years.
The taxi drivers, coach operators have been taken under the wing of the Department of Infrastructure. It is largely the Department of Infrastructure that has administered the grant scheme which has been applicable to them, and should the member require, I would of course be happy to provide him with the exact figures in relation to that grant scheme. In relation to Part B of the CBRSS, I don't have the specific figures in front of me for taxi drivers. I'm happy, and taxi operators, I'm very, very happy to supply them and will do so as soon as possible.
Mr. McCann for a supplementary.
Sorry, last Concordia. Minister, thank you for your information thus far, and thank you again for your best wishes. It's just been a 39-year engagement, that's the way we look at it. But your economic recovery strategy commits to extending apprenticeships to people of all ages. While this is welcome, would the Minister agree that many older people who are likely to have higher costs and commitments would find it impossible to survive on an apprentice wage of $4.30 an hour? And do you agree that the best way to address this kind of issue is by transferring the minimum wage powers in accordance with the New Deal, New Decade approach commitments, so that we can set our own incentives? Thank you.
Well, first of all, again, I would have to say that apprenticeships, training, prospects for jobs and for life are probably the most important thing that we can do to create a stable, prosperous Northern Ireland, giving people hope, the ability to earn a living, and the ability to be part of society is a really important thing that we can do for Northern Ireland. I spent some time this week, the member will be glad to know, talking to my officials around the issue of apprenticeships, how we can extend the apprenticeship recovery and retraining and the new apprenticeship package right through this year and indeed into the next year, and how hopefully I will be able to bring fairly soon to the Assembly the news that we are able to open up apprenticeships to all ages. It is, of course, imperative that firms are also not just incentivised to take on apprentices, but that apprentices can earn appropriate wages. And we will look at all of those issues as we bring forward the package on all-age apprenticeships.
Thank you very much.
Thank you, Minister. And now, if we can bring Mr Daniel McCrossan remotely into the meeting. Mr McCrossan.
Thank you, Mr Principal Deputy Speaker, and thank you to the Minister for the answers to the question so far. Minister, you'll be aware from various correspondence with myself and other SDLP MLAs that caravan owners from right across the north feel deeply aggrieved regarding the costs that they have incurred over the past year in significant site fees ranging between £2,000 and £3,000 in some instances, despite not being able to use their caravans. Can you, Minister, outline if you have engaged with the Minister for Communities, or what action has been taken to ensure that all those with caravans are not severely financially disadvantaged due to COVID-19?
Well, I, like the member, have had an enormous amount of correspondence from caravan owners, some who have had site fees partially returned last year and others who haven't. Those are contractual matters for the individual and the site owner, and we should remember that. But by far the largest volume of correspondence that I receive from caravan owners is to allow them to return to using their caravans in a properly safe, COVID, socially distanced way. I hope that we will be able to give them some further information on that in the very near future, and I know that many caravan owners that correspond with me will be very glad to hear that.
Mr McCrossan for a supplementary.
Thank the Minister for her answer and for recognising that there is an issue here. And Minister, I do understand that there is a contractual arrangement between caravan park owners and caravan owners, but there also is a responsibility in this House to ensure sufficient regulation to ensure that those caravan owners are protected and not abused. In some instances, there has been very few who have received discounts at all, given that the caravan park owners have received government intervention. Does the Minister believe that there should be government intervention for those caravan owners who have had to pay out thousands without accessing their mobile homes?
Well, of course, as I've said to the member, the contractual issue is one between the caravan owner and the site owner. If the site owner is amenable, then I think that it is reasonable to assume that if you're unable to use your caravan, that you should be able to have a discount in relation to that.
I've received no notification that Ms Sinead Bradley will be joining us remotely, and she's not in her place, so we'll move then to Mr Justin McNulty.
Minister, on the 25th of March, the Comptroller and Auditor General said at the Public Accounts Committee that your department were paying third-level institutions a 10% fee to administer the £500 student grant that I'm happy to say the SDLP led the campaign for. Given that 40,000 students are eligible for that grant, can the Minister confirm that this is actually the case?
The COVID disruption payment was a unique opportunity to support students here who attend institutions within Northern Ireland. And of course, in order for us to be able to give that payment out, which is unique, we had to ask the universities themselves to do that, since they would have access to the appropriate information to make the payment. It is important that we acknowledge that universities would incur cost in relation to that, and that they are remunerated in relation to it.
Mr McNulty.
Thank you for your answer so far, Minister. Minister, that means that £2 million has been paid to universities to administer that fee. Do you not think that that money will be wiser spent on those students who you've excluded from that scheme, those students studying in Britain, those students studying down south, those students studying further afield? And can you advise when will those students be included in the scheme?
Well, of course, the member is absolutely aware that we did take advice on the remit for students studying in Great Britain, or indeed students studying in the Republic of Ireland. We supported the students and the institutions that we publicly fund here in Northern Ireland. And of course, students who are in Great Britain, students who are in Northern Ireland, will be able to claim funding from the university that they attend. I think in Scotland, something like 30 million additional was made available for student hardship. I know that in England, just recently, an additional 50 million was made available for student hardship, and in Wales, something in the region of 40 million was made available for student hardship.
Ms Karen Mullen.
Ask Cian Collier and thank the Minister for answers so far. Minister, wanted to ask if there was an underspend in your department's £10.6 million allocation to the wet pubs support scheme, and if you would consider, or if you are going to consider, supporting wet pubs going forward if trading is limited when they reopen.
The wet pubs scheme was based on the number of pubs that were identified as being within that category by the Finance Department and through the local rates schemes. So we were given the number from those schemes. When we actually wrote to those particular businesses, many of them had been able to open and declared that they had been open for part of the summer and therefore would not be eligible and would not meet the criteria of the scheme. I will be happy, of course, to write to the member with the exact figures in relation to the uptake of the scheme and as to how that is worked out. But I do commend those who forthrightly said we were open during that period, even if only in a limited way. And I think that that is commendable and very, very important for us to recognise. Going forward, we really do want to see businesses to be open, to be viable, and to open safely. And as I've said many times in the last number of minutes in this House, we need to give those businesses a date for reopening as soon as we possibly can.
Ms Mullen.
I thank the Minister for her answer in relation to that. Minister, unfortunately there is a growing concern in Derry that you are less than enthusiastic around fulfilling the commitment for the McGee expansion that's a New Decade New Approach. Therefore, could I ask you to provide an update on any engagements and work with the Ulster University in regarding the commitment and delivering on that expansion to 10,000 students at the campus?
Yeah, can I thank the member, and I will write to you very specifically with all of the details in relation to my engagement with Ulster University and indeed in relation to the McGee campus. It is, of course, for the Department of Health to identify need, to do the business case, and we will, of course, administer that in relation to the medical school. Everything is progressing, as far as I'm aware, on time and in an appropriate way, and I haven't been notified of any kind of bumps along the road. Just recently, I actually signed off on the strategic outline business cases for 2 projects for the McGee, which are being delivered in relation to the city deals. Both of these projects are worth in the region of 50 million to the university and will substantially increase its ability and its research base at that location. But of course, Ulster University is also a 3-campus university, and we would like to see their plan in relation to all of the campuses across the university sites.
Ms Claire Sugden.
Thank you, Principal Deputy Speaker. Minister, can she give us any indication when FE colleges will return to face-to-face teaching in line with the schools that returned earlier this week?
Yes, can I again thank the member. This is a really important issue for many FE learners and for those associated with the colleges. And I hope that after Thursday's executive there will be definite dates in the pipeline. Of course, FE colleges have been open throughout for those who needed to do practical subjects and had to go in to do that, and the rest was taught with remote learning. However, as we come up to those very, very crucial professional exams, many of those young people need to have the practical experience that they require in order to pass those exams. So if you think, for example, of young people who are studying health and social care, or young people who are studying hairdressing, or whatever it is they're studying, because their part of the economy has been closed, it's been very difficult for those young people to gain the practical experience that they need in order to progress. And we need to work urgently to make sure that those young people can all succeed and get their qualifications as they need to in the summer.
Ms Sultan.
Thank you, Principal Deputy Speaker. And I forgot to declare an interest in this area. My husband is a college lecturer, but I'm not asking for him. I am actually asking on behalf of a constituent who is concerned that her daughter had chosen an FE pathway instead of going to sixth form, and she's worried: are they being disadvantaged because sixth formers are now back at school, but FE students are not? So I look forward to dates on Thursday, hopefully. But I think it's important that no one is disadvantaged in our school system, whether it's
Can I just say, I absolutely agree with you. I think that our FE colleges are absolutely amazing places of learning. They're not just about learning, they're about a whole community of people who are at that college, and such a broad range of people who are doing foundation degrees to some of the most vulnerable young people in our society. No one should be disadvantaged, and this executive in this House should be concerned about the future for young people. That is the future of Northern Ireland. We must work to build it.
Thank you, members. That concludes questions to the Economy Minister. Item number 5 on the adjournment paper, item number 5 on the order paper is the adjournment. The question is that the House do now adjourn. The Assembly is adjourned.
Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary.